All right, welcome back. It's been what 6 months. Today we're gonna do our eighth episode of Talk Doctor to Me. Funny story, we had one more, but the recording had so many problems because of I think power outages, and then we decided to take a 6 month hiatus. And now we're back. I think it is our eighth episode, and we're excited because we're gonna talk about a bunch of different things. Also gonna keep it on health as well. Again, it's me, Prabhat Garg, and my friend Evan Liggett. And let's get started. Let's start with the state of the economy, because we're economists here. I wanted to let's see if I have any notes here on the economy.
What's your take on the economy? What's new? What's going on?
Well, I think markets are like in terms of like stocks and stuff, things are all-time high. Nasdaq's up, which is like the tech funds, tech stocks, and jobs are great. And I think we're decreasing interest rates. I think we decreased another quarter point today. So I think U.S. is booming. What do you think?
Well, so I was busy today at work, but apparently they decreased the interest rate by what, a 1/4%,
Yep. Today.
and but the stocks plunged at the end of the day. What happened there?
I mean, so it's a lot of the stocks kind of go based on like um, expectations. So I think a lot you can argue a lot of the market had already expected a rate cut, but they were expecting a lot more. And looks like the government, I think Jerome Powell, the Fed guy, he made comments saying maybe we'll slow down on the cuts.
Why do you think so? Why does he not want to make any more cuts? What is the data behind that?
So, okay, that's a good question. So, I mean, Fed's job is two things, needs to two main roles and has to do those. One being it has to check inflation, so which means price stability. Prices of goods and services can be going up and causing a lot of inflation because it hurts a lot of people, especially poor people. And the second thing is it has to make sure there's maximum amount of employed people as there can be. So unemployment needs to be very, very low. So right now, the economy is doing well. People are employed to a really good percentage. Obviously, the economy is perfect. People are employed and prices are low. You can say, interest rates can be as low as possible just to keep the market going. Low interest rates means like, kind of like gasoline on a fire. Things go boom, boom, boom. People borrow money, start new businesses. So economy heats up. So that's a lot of people are probably wanting, especially in the housing sectors and sectors that have a lot of borrowing involved, build real estate projects, including housing. So they are probably getting hurt still. So that's why people would like lower interest rates, even though from an employment standpoint, everything is fine. And from asset valuation, including stocks and houses prices, people who own them are loving the upright.
I know that inflation was coming down. Did that tick back up, or did it not go down
I
as
think
much as they
I think
thought?
it's been going down steadily. It's not all the way down, but I think it's like 90% gone.
So what do you think with the upcoming change to Trump? What are your predictions for the economy in the next year, 2 years? I've heard various things.
So the expectation is Trump is going to pro business, is going to remove reductions, especially in the tech center, and a lot of big companies can resume, um, a lot of mergers and acquisition activity, which is exciting for big companies like Amazon, Google, or at least in the tech space, and the startups because they get to exit and get a big paycheck. So I think there's just a lot of expected positivity. And sometimes expectation is actually good enough because when people expect good things, they spend a lot more than they would have otherwise. They're not saving as much, and the economy keeps buzzing. So I think it'll probably continue to do well because I haven't really seen any slowdown outside of housing, and so I don't really expect a big change. The only other caveat is these tariffs. If he does them, then there's a good chance prices will go up.
So do you think it's just next 4 years is going to be slow, steady growth, or do you see what's your I need to put some money in the market. Tell me what. Give me some
I
advice.
think it'll be slow, steady growth. I mean, I'm on the careful side. I'm always looking at the downside because I think things are kind of richly valued still. I think Apple is already almost a $4 trillion company. I mean, it was like 3 trillion like 6 months ago. So I mean, it's added another $1 trillion based. I don't understand based on what other than like hype about AI. So I would expect rapid growth if things were moderate level, but I think there's already a lot of excitement when these bull markets or exciting markets happen. They can continue for a very, very long time. But I don't know. I think AI is the biggest wild card because there's a lot of hype around it, and a lot of that hype is probably justified because it's productivity can't go up for these companies. Let me ask you about like just Apple. Like what is your iPhone? How old is your iPhone?
Couple of years, 1 year, 1.5 years,
Do you have
one
an
and a
itch
half.
to buy the new one with the AI in it?
From what I could tell, it's not real useful at the moment. So no, when it becomes more useful, I will.
Okay, fair enough. Mine is like 4 years old, and I just changed the battery, and it's working just fine. And I've tried like on one of the Apple laptops, and I it has whatever Apple Intelligence they call it, AI. Trying to be funny. My impression is, I mean, ChatGPT is just so much easier to use, and it's clear, and it's ultimately I think using ChatGPT or something similar, but there's so much friction to it currently. So I think maybe in a year or two they will polish it up. But right now you can't really beat like ChatGPT. Even Google isn't as polished. Like I think Google has some really good products, but in terms of just convenience and familiarity, I think ChatGPT is next.
So is it going to be like talk to Siri and they're giving better answers than what they're getting right now, or what is the benefit of AI in the iPhone?
I think it's some of that. Like you talk to Siri, it will understand your question more. It'll give you like instead of just before saying I don't know what you're saying or what to or here's some links to the websites. I think it'll give you smarter links right now. I don't think it's talking back to you. And then sometimes like you're writing something in messages, you can ask it to like rephrase it. But you
So
can do a
Apple's
lot of
creating,
that.
sorry, LLM or whatever you call it, their own
I think they
system.
are. Or they're just using like I mean they could just throw like a Facebook has created a bunch of them and then release them so anybody can use them. So Apple could just use those or they can train their own. But they're creating the biggest cost here is like running them. It's the one thing to like train them and the one thing is to run them. And to run them you need a lot of infrastructure and compute and chips. So I think Apple is building their own cloud because Apple so far has been able to do everything on the phone. They do a lot of processing. They don't want to. They've kind of set Google. They'll talk bad about Google and Microsoft because at least Google, I think, because a lot of Google services happen in the cloud natively, like Google Maps, Google searches. So a lot of your data leaves, and Apple has historically been a company that prides itself. Well, all your passwords are on your device. We never have them. The iCloud is secure. But for this, they're creating a cloud service that can run information that's your personal and somehow keep it like fully encrypted where Apple won't see it. But honestly, in terms of experience, like just going into a ChatGPT app and asking your question about search or whatever, you want to learn something, you want to rephrase something, then you can work it on your computer. This cross platform, you can have Windows computer and your same account will show up there or your iPhone. So there is something to be said, but I don't know. Maybe I'm like one of the tech forward people. I think a lot of people still use like Google search and if they won't really touch anything other than like if it shows up on your phone, it shows up in Siri, only that's when they will change their habit, which is understandable and Apple has that power. So maybe that justifies another $1 trillion. I don't know in their valuation. So I
What
mean,
are
yeah.
your
So I
thoughts?
I mean, it's just this, things are like people are buying. There's zero fear. I don't think anybody's really fearful. Bitcoin is over 100,000. That doesn't say fear to me, which is like all time high. Tesla is over $1 trillion, a trillion and a half. But I have used Teslas, like my brother has a Tesla, and the self-driving is much, much better than I thought it would be. It's actually gotten objectively better.
I agree with that. I had a 2 month trial essentially, and the first time I used it, I didn't feel comfortable letting go of the wheel, and it wouldn't let me let go of the wheel, which was the stupidest thing, right? Like the I don't want to. They have this built-in system. If I don't have a subscription for the self-driving, and I want to do adaptive cruise control, I have to keep my hands on the wheel, even though it'll keep me in the same lane, following a car at a safe distance or whatever distance I want to be, aggressive or not aggressive. But it still makes you maintain your hands on the wheel, like not only on the wheel, but the way they gauge that, besides the cameras, is by tension on the wheel, right? Like why am I putting tension on the wheel if I'm driving in the same lane? Why is that a
Yeah, you have to
feedback?
forcefully like move the wheel a little bit just to
It's the
like.
most insane, the stupidest thing ever. Like that should not exist.
Yeah, I think they might get away from it because I think once you have the FSD, then it just the camera will look at your eye that you're looking at the road, and then that warning to keep the wheel engaged kind of becomes very little.
Well, the first time I had the first trial, they gave a trial last year of FSD and they had the same feature. You still had to have your hands on the wheel. And I thought it was useless. Now they came out with the latest free version, and I did not have to have my hands on the wheel. I have to say it was just so much,
Easier, right? Yeah.
yeah, it was much easier. Definitely rely on it getting me to my destination um, in the air, in the vicinity. When it came, like it wouldn't drive me to my garage, right? Which I think is silly. I think it should learn that I'm going to my garage every time I come home, and it should bring me to my garage and be able to open my garage door. Those simple things to me, anyways, it got me to the front door.
Yeah, I went to Dallas to Austin recently with FSD, and I mean it's basically parking lot to parking lot, where I mean it's yeah I won't like come. I mean like the very very last 100 feet are sometimes tricky for it. I mean, it'll figure out which supercharger you need to go to. Like, you really don't have to think about it. And I'm like, it's changing lanes, and I'm just like, I'm looking at the road, but I'm not actively planning anything. It's such a weird feeling to be like, wow, like it's just been making all the decisions, and your passengers don't think you're doing it. Like if they don't know, like they're like, wait, what do you mean it's driving itself? I'm like, yeah, there have been some ghost things where I'll be like, just I'll be waiting at a red light, or I'll be waiting like I have the navigation on, FSD on, and I'm expecting it to take this entry onto the freeway, but at the last second it decides to like go a different way, and these kind of like ghost navigation errors, like it doesn't do anything unsafe, but it ruins the navigation. Like it'll take a longer way out. Told like what happened.
Yeah, one thing that it did unsafe for me was that when I come to the stoplight before turning onto the road to get to my house, it's a two-lane turn. You can turn right out of two lanes,
Oh,
and
I
it
see.
would
Yes.
consistently turn into the other lane when it would turn. I would be in the far right lane, and when it would make the turn, it would put me in the lane as if I was in the lane next to me. So that's if there wasn't a car there. If there was a car there, potentially, I guess it would have seen the car and not gone over to that lane, but it didn't keep me in the same lane. And that was not just at that light, but at several lights. When there were two turn lanes, it would kind of get confused
Yeah, so
and
it's
go into the other
definitely
one.
like I don't think we are at like close your eyes, go to nap, take a nap, and then drive. But I mean it's much better than it was I think a year ago, and I think they
Yeah.
already have like the next version in training that they haven't released.
Well, I don't. The fact that they don't want to use LiDAR kind of baffles me. I think that's getting in the way of progress, and for that reason, I don't see them catching up to Waymo anytime soon, to be
Have you
honest.
used
Like
any
it,
Waymo? I've not.
I have not, but the people that have used it sound, I mean, and they're in how many cities now? At least three. So, and they've built up more and more miles of safe driving. So, yeah, I think they're ahead, and I think they'll be ahead for the next couple of years.
Here I'm sharing this news article. So Uber and Lyft stocks plunge as Google's Waymo comes to Miami.
I think this is going to be the total changer. Yeah.
Yeah,
Yeah.
because I mean, if Google owns their own cars and they just integrate this kind of stuff in Google Maps and they charge you less than Uber because they don't have a human in there. I mean, people trust Google. Like, they're not gonna think it's a crappy product. It may not work in every city. I don't mean, it sounds like in San Francisco and some of the Californian cities, wherever they are, there people are loving.
I think they're in San Francisco, Phoenix, and Austin, is what I
Oh,
understand.
that's right. They're in Austin, huh? I didn't see it. Maybe I was
And
reading too slow.
I think it's just about training for each city. I think they're going to be slowly unrolling cities as they train them, and you're going to eventually be able to, if you live in one of those cities that it's been trained in, you can actually purchase one of these and use it how you see fit, but it's not going to be useful outside of that city where it's not been trained, where it's, so as one person described it, someone was like, so if I have one of these, could I go to work and then send it to do errands throughout the day while I'm working and like go get groceries and whatever? And the host was like, no, probably what's going to happen is the grocery store is going to buy a fleet of them and they're going to be sending them to do things throughout the day. Um, anyways, however
Talking
it
about
rolls
Teslas
out.
or Waymos here, or both?
What Waymos, or I mean, just driverless taxis, Waymos, those what I
Oh, I
was
see.
referring to.
I mean, I don't know why they can't just be fleets of them driving point to point and whoever needs it for whatever purpose. Like, I don't know why Amazon can't tap into the fleet and deliver a package or and Whole Foods or grocery stores. So I think that's I think there are a lot of what ifs, but if it works and it's safe, um, I would love to not have to have a car. You know, like all these garages that just go away and people turn into housing or like workshops. I mean, imagine what you can do with all this new space. You don't have to have a car and
I think
insurance.
I think it's going to be tough to change in America. Me personally, I would still want a car.
Why can't you just go to like take one of these taxis, go to Hertz, and like rent one if you need one for a road trip, and then
If you told me that the cost was going to be equivalent or less, and that the wait time was going to be inconsequential, then I
well,
would
I'm
think.
assuming significantly decreased cost. I don't know why. I think because there's no human, I feel like there could be, let's say, like 10 times less cost, but
So you're
theoretically.
saying, so over the, let's say I buy a $30,000 car, I have it for 5 years, I have to pay for maintenance, I have to pay whatever, you're saying
Gas,
all those costs
insurance, yeah.
are just paying every time I want to go somewhere would be less than if I
Let's
over
just say
those
it's
court
50% less than the maintenance of the car. Yes,
than the maintenance or the
up to
like.
total ownership cost of the car is is let's say twice as much as owning, or to just like using paying as you go.
Yeah, I mean that's a sell.
And wait times, let's just say, drive having your car going to work, you can just get in it, park. Maybe you have to spend times parking, where this just shows up and drops you off in the front and just you just go.
Yeah,
That's a
I mean if you told me that, then that would be convincing. Yeah,
The only thing is like you can't have your storage, like people leave their stuff in their car, their coats. You can't do that, but maybe you'll just adapt there, you know?
yeah, yeah, that's a good point. I don't know. Yeah,
So I think and what do you think about Uber versus Lyft's like Uber? I think Lyft's are struggling a lot more. If I were, do you use rideshare?
I do on occasion when I go to the airport, usually
What do
as
you
a
think
night
is
ticket.
a valuation difference between Uber and Lyft? Granted, Uber also has Uber Eats business as part of the business. Like I have the numbers. I wonder if you can.
I mean, I've
I'll
heard
tell
things.
you. Tell me like how much is Uber is valued at? That may be
I
hard to
couldn't.
believe.
I couldn't even
Let's
ballpark
say
that.
130 billion is where it's roughly. That's Uber and Uber Eats. What do you think is Lyft's valuation? If knowing that Uber is 130 billion in terms of like market,
A quarter of that.
it's like 5 billion, which is a 20th, less than a 20th. Isn't that incredible? I think Lyft is struggling a lot, and that's what
Yeah.
markets say. Do you think what has a better in terms of people using the app? What do you think has a more uh, user, or I guess what I'm trying to say is, do you think if these taxes work out, like Waymo works out, do you think people would still prefer to use the Uber app to book them? Do you think Google has to pay Uber for people to use their taxis, or they could just be like, use Google Maps?
Yeah. Why wouldn't they just use Google Maps?
Yeah, I agree. I agree. Which is kind of scary for.
Yeah.
Do you have any Bitcoin? Next topic.
I own 0 Bitcoin.
How do you feel about that?
Not good.
I own zero too, and I have so many friends who were like screaming at me to buy when it was like 20,000,
Uh,
15,000, like in the last 2 years. I mean, I just don't think, I still don't think it's a good thing, but, or it's a, like, there are two things that worry about my Bitcoin. First of all, like, there's this company, MicroStrategy. It's like a legit software company, but they're like borrowing US dollars to buy Bitcoin. And they have been, like, for the past 4 or 5 years, I think. And now they're part of the NASDAQ. So whenever you're buying some index fund, you're automatically buying into this company. So it's kind of like this kind of debt fueled asset price. Like if Bitcoin goes down for some reason, like they're like it can hurt it really bad. And now Trump is pro Bitcoin, so there are some rumors that he's gonna like somehow have the U.S. government buy some like a lot of Bitcoin, significant amount of Bitcoin as part of reserve. And a lot of his supporters are tech bros, Silicon Valley Bitcoin people.
yeah, I listened to the CEO, or what's his name? Was that, I think, the CEO talked on a podcast not too long ago.
MicroStrategy CEO,
Yeah.
Michael Saylor, or something like that.
Yeah. Yeah.
What do you think?
Yeah. It was all. I mean, he's certainly enthusiastic about it. I can't follow him. I guess I'm not intelligent enough, but I couldn't. I'd have to like break it down and listen to it on half speed and like try to figure out what the hell he's talking about. But it's, I didn't. All I could get out of it was they're, yeah, they're figuring out how to loan money based off of the valuation, and the way he makes it sound is the only losing situation for them would be as if it went to zero. Otherwise, they're gonna win. I'm like, I don't know how that's possible, but whatever.
Right. Yeah, to me, just I want to understand it, and I feel like there are better ways to invest. It's like for Bitcoin to succeed, I mean, U.S. dollar has to basically not be worth anything, which is such a weird concept for my brain to process. To have a country that doesn't control its currency, what like what does that even mean? And like how like that sounds like civil war type situation to me because we
You would
rely
think
on money
that the country
printing.
that has the currency of the world would just do whatever they could to maintain it.
Would be the most anti-Bitcoin country.
Right. But of course,
And it lets
it's
us like
run.
pay our bills because we can print. But if Bitcoin really becomes the currency of the world, the printing stops like suddenly. And that calls for revolution. So that's scary to me. Have you been keeping up with AI stuff? Any like what is your AI
So
use case?
Oracle is the company that I've been most
Okay.
interested in lately. So what do you think of Oracle?
Well, you invested in it. Tell me what you know about Oracle.
The CTO
This is
and
not
a
investment
couple of,
advice.
yeah, do not take this as investment advice for those of you that are listening. And all right, do we have to make that disclaimer even though
No,
nobody
I
listens?
mean this is like nobody's listening to it anyway.
So they're saying the right things. They're saying everything that, and the Larry Ellison, and then there's a couple of people in the company. One of them was a doctor, and one of them, I think, was a nurse prior, or at least was involved in healthcare in some way. And all of them are saying, and I'm sure, of course, it's not coincidence, but they're all saying the right things, the same thing that I'm thinking as a physician of how I want medicine, how AI could be integrated into medicine to make it better, more enjoyable for me.
What is that? What is your vision there?
So my vision would be I go into the patient's room, whether it's in the ER or it's in the clinic, I talk to the patient. We have the discussion. We're done. That clinic visit's over, and the documentation shows up on my computer. I can read through it, but it's exactly how I want to chart based off of my past experience charting. Has all the information that I want included, and it would even give me maybe some diagnoses that I am not thinking about. As you know, as we've discussed before, and you sent me an article today about how AI is kind of better at finding the right answer than the doctors are in many cases. So it could give me a differential diagnosis in addition to what I'm thinking of, right? It could make me a better doctor, and it would do all my administration for me. And I could just read through that note, press sign, make any modifications I needed to make, but hopefully over time that would be minimal and it'd be done. The biggest burden for me is any type of administrative work. Name it. Like, also, I go see a patient, or I have a patient on the floor right now, diverticulitis. I want to send her home today. I talk to her. I have the microphone listening. It creates the discharge summary. It creates the follow-up visit. It does everything that I need to do from an administrative standpoint. It prints off informational about diverticulitis and recommendations, and that kind of thing. And that's what they're saying. In addition to helping with billing and drug discovery or whatever.
Okay. So, I mean, the dream is the interactions become 100% kind of face-to-face interaction with the patient in the room or in the OR. You go and outside of that, basically pretending there's this virtual team of smart scribes and that have some medical school training, like have more trained because they will misspell things, they will have the context. These army of really smart scribes who are doing all the work, and then at least that's the office work. Have the note ready that you're just reviewing, and then the back end sending referrals or scheduling things. All that is also just taken care of. So 99% of your time is just with the patient. You're not calling the patient. If there's telemedicine involved, that's as effortlessly like you can picture. And I think like there's no scheduling of HR personnel or office work or someone called in sick. They're like it's just taken care of in the ideal world, and all the histories pulled like from the EMR because Oracle
Right.
owns Centricity. Is that what it's called?
No, Cerner.
Cerner. We don't use Cerner, but yeah, so one of the top 3 EMR in the United States or globally. I don't know. I think the U.S. government uses Cerner, right? The VA hospitals or whatever.
The VA is working on something, but all the military systems use it.
Military Cerner. So I mean, and they're not going to change it anytime soon. In terms of they're not going to switch away from Cerner. Cerner is just going to Larry Ellison will work with the U.S. government to like cater to whatever capabilities need to be in there. So yeah, I think Dream can be even bigger than that.
Sure.
In terms of some low acuity stuff, we start rethinking like how much does a doctor or medical personnel needs to be part of this. Like can these systems be intelligent enough to actually take those off or highlight the red flags one that needs to have some oversight. And I would do it both ways. Like right now, we make over-the-counter things like NSAIDs, like ibuprofen. Anybody can go get it. I would even move them to provide some AI oversight because there are some risks associated with them, which we just, you know, assume the patient will know about or will be smart about. But there, I see side effects. I see people with bleeding come in a lot. So I think moving some of the regular over-the-counter drugs also part of this loose umbrella of incredibly smart embedded AI system that can do things cheaply, efficiently, and I would say globally, like not just if it works, like why can't somebody in a village in Africa or India tap into this virtual aid?
No, yeah, I mean, apart from, I guess my response was just in related to my job and
Correct, correct.
how I believe that Cerner could integrate into what I do. Now, as far as like overall healthcare, absolutely. Like, I don't think this is going to be Oracle. That's, well, maybe it is, but I don't think it's going to be EMR per se. But like having your own personal health assistant could totally transform healthcare in the United States. And I think that's a discussion if we're going to talk about the CEO shooting, whatever, like healthcare in general. Yeah, I mean, having an AI assistant is probably in the works, you know.
So I mean, so you use Cerner at work, so it makes sense why you you use the software, you listen to the company management, the visions aligned with your vision, so you see potential. Okay, I think it's probably like I think it's a very strong company. My only hesitation would be is the uh, valuation wise, is it too expensive? But I think it's actually okay. It's 10 times revenue.
It's kind of down. I mean, it was I, I bought it at the not maybe not the best time, but so I one thing I missed that my buddy pointed out was they I guess own the data for TikTok. They store the data for TikTok.
Yeah, TikTok they're like the American partner. Like TikTok runs on, how AWS has their own server, Amazon has servers, Microsoft, Google have their own cloud, Oracle has like their own cloud, and I don't know if they runs on other people's clouds or they have their own cloud, but yeah, TikTok somehow has like their US partner when Trump came into, or when Trump was leaving office, like whenever COVID came and TikTok was going to get banned, a couple companies came forth to be the US partner, and Oracle won that deal.
Well, I had failed to realize that, and then of course TikTok has got the
Getting banned.
impending possible ban. So like, is that going to be reflected in the stock price over the next month? Maybe I bought it at the wrong time, but
No, I mean the price is. I don't. I mean TikTok is such a small part of. Like you don't buy Oracle because you think they own TikTok. You buy Oracle
right.
because they they dominate databases and they have Cerner, and this founder is kind of ridiculous. Like what he's like 80, 90 years old and it looks like he's like 50. It's just like I don't know what it's like a Japanese garden.
I don't know if what they're talking about comes to fruition, and if they can if they maintain the same market share, even get some more, I see it being a big player in the healthcare industry. I mean,
It already
I'm sure
is.
right, it already is, but and I'm sure the other companies are saying the same things or similar things, but they have he specifically is trying to, at least what he says, he's like hiring engineers with that vision. I think he had either his mom had a healthcare incident that kind of brought everything to light for him, but he's got like a personal interest in making the things that I see happen. So it's kind of
I
encouraging to
don't
me.
think so. I think I'm saying that's probably just PR. I think healthcare is a huge market that big tech has kind of stay out of. And I think he bought Cerner because he wanted to make way into that huge lucrative market from a software standpoint. Like the software guy is going to dominate, right? Like no, Epic, we use Epic, and they are a private company. You cannot invest in it, but they are incredibly well positioned. And they already have some of these systems that I think our clinics are starting to use, and the feedback has been very positive. People love them. So I don't think it's a hard thing to do given the tools that are available today, the dream you described. So it's really distribution and then iterating on it and then seeing where things go from there. So that
No,
game,
I think the technology is already there. I mean, as far as like
exactly.
writing your note, and
Yeah,
doing the coding and billing, yeah, it's just about integrating and then
yeah, yeah.
refining.
I mean, it shouldn't be too hard.
Well, the impediment is HIPAA, like privacy, and as far as like that's another thing is like there should be a way to communicate between Epic and Cerner, right?
There
That
should,
shouldn't
I mean,
be.
yeah,
You should be able to go anywhere in the United States, and your information, which is a thought I had, was going to run by you. Like, what if you could just show up to any hospital or any clinic on your phone? You have your health record that changes every time you interact with the system, and then you kind of buzz in with your QR code, and within their system, they get all of your health history,
I think
including.
that is a beautiful dream that I have kind of given up on. I think it's like anybody who thinks about healthcare is assume that we already had a system that talked to each other. When they
No,
learn
who's
that we order things because we don't have access to the data that was done in a different hospital, and the patient doesn't understand, like, they just go to the closest hospital when they have an emergency. They don't understand why in 2024, soon to be 2025, data is so it's not shared. It's called interoperability. Like, the EMRs don't talk to each other. It should be perfectly seamless while being HIPAA protected. I mean, like banking has figured it out. Like all these sensitive industries have figured out how to share data in a sensitive manner, but still accurately. What makes healthcare special?
well, it's the information is much more personal than your banking information. I mean,
I mean,
I think
it
anybody.
is because I guess it's not just read only, right? Like read only and bank doesn't have as much uh, third part possible negative outcomes in health. But still, I am on the side that there's too much red tape. Like the red tape needs to be rethought. I think it's
I agree,
comes,
yeah,
yeah.
but I think that's why I think we're you're not as optimistic, but I think we're reaching a point where with the technology and data storage to where we will get to that interoperability. So
Or
that's
it might
my
be where
hope.
when you go to the hospital, instead of hospitals sharing with each other, like you said, it just syncs to your phone.
That's what
Like
I'm
you just,
saying.
yeah, and then yeah, your phone just has like all the pertinent information, and it's not in the
Right.
cloud, or maybe iCloud or whatever. Like like your phone backs up like your photos, and yeah, I think that would be pretty cool actually. You know,
Right. I mean, you basically interact with the system. You update your phone. I mean, it's all in the cloud anyways.
exactly.
Well, I guess it's not. It is and it isn't. Like within each system, they have a data center. But that's not necessarily. It shouldn't be in the. It's a cloud, but not a hackable cloud, right? They're able to have their own security to that data, right? As opposed to if it's on your phone, it's not going to be.
But I mean, any cloud is gonna be hackable. So I mean, we have to go like. So should we go back to paper, which is 100% non-hackable and painful and slows down everything and probably has bad outcomes that you cannot measure, or do you accept some data leak risk, but gain so much more efficiency and reduce friction? I would think a lot of people, a lot of patients will agree that they rather live in the modern age and not have to use paper just because there might be a hack.
I agree, and that's where I hope it goes. Yeah, that you could. One vision, like I said, was I go to the hospital or I go to the clinic, I leave, I do my QR code, my data gets updated with that information. I go to the next interaction, I bring it QR code or however you do it, and then all that information, even though it's a different system, it's able to be used by the other system. And again, it goes into your AI generated note. Like if I don't, if the algorithm or if the LLM doesn't know that you went to that other visit and what the outcome was and all the data, the imaging and whatever was associated with that, it's not going to have as good ability to come up with differential, or you know what I mean. You need all the data you can to, just like you do as a practitioner. I mean,
True.
anyways, we went down that rabbit hole. What else? What's your excitement with AI, latest in AI?
Well, I think it's getting so much smarter every day. Like I have ChatGPT like premium or whatever the $20 one is. It have access to like the smart one, like the whole one.
Wait, isn't
The
there one
prop,
that's even more expensive now?
yeah, there's a two hundred
You're not, you
dollar
don't.
one.
I
But the
thought you were
thing
gonna
is,
get that.
like the $20 one, because it tells you when you use it, like it's thinking for a few seconds or minutes. I can't come up with the hard questions for it to think for more than 10 seconds. So it's just like I have to think of different like complexity in finance or healthcare questions. I think it's just these questions are too stupid because it's like that open model that is even the more you can run in the $200 one. That's designed for hard math and physics, like physics PhD type, where you have to understand reality and what are the third order effects, like these very detailed questions. So I think we're at, for my use cases, I think we have a very cheap model that will do it. And I don't need a smarter model to solve my problems. And even the cheapest, the poor man's version, like if people pay for it using like APIs, like
Hmm.
that is plenty smart. And they're not storing, like I think just now in December, OpenAI and Google released a bunch of new things, video generation. I think today the ChatGPT people, OpenAI released a 1-800 number. So you call 1-800 ChatGPT on your regular phone, and on the other side, like the voice assistant ChatGPT answers your questions, whatever you want to chat.
Oh, really?
So your grandma can now use ChatGPT. Like people that can't use smartphones can now use ChatGPT, because for the first time we have a tech company that created an interface that you can use to a rotatory phone. Think about that.
So wait, can chat? So what was the deal with the Scarlett Johansson voice thing? Was that just the
Like the voice of like, because they can have like artificial voices. I think one of the ones they use, they try to use Scarlett Johansson's voice, and then she declined, and then they used something that was very very close, and then she
basically
still
her?
sued.
So wait, can it create voices that
I mean,
like
the
mimic other,
capabilities
like?
are there. It's just like like legal things that are. So I mean, ChatGPT gives you some voices to choose from, but I mean, they're planned. Like 11 Labs is a company that's an AI company that dominates sound and voices and synthetic things. So, but I think a lot of them can do it. You just have to kind of do it more manually because it's a sensitive topic.
What about SoundHound? You on to SoundHound?
I know it's an AI company, and I think Nvidia owns like a part of it. But beyond that, I don't know what it is. Something with sound, I imagine.
Well, it was my buddy brought me onto that one. It was at like 5, and then
Oh, you
he
bought the
got some
stock?
in. He got intel that it was about to go gangbusters, and he didn't. I don't think he got in, but latest was like 22, I think. But who bought, somebody, Google or somebody put money into them or had some relationship. But I think they create the voices and the whole system regarding, like, when you call in to place an order for something,
Yeah, but so many
the
people
whole.
can offer those services now. Like it's not
Well,
a
for whatever
crazy.
reason, this is a popular. This one is gaining traction. What
Okay.
is their what is their stock price today?
21,
I was
22.
gonna. Man, when he told me about it, it was at like 15. I was like, all right, I'm gonna get this one and Oracle.
This is
And
like trading, like speculative stuff. I mean, it's high growth thing. I would put a lot of money. I mean, I think it's fine to play a little bit, but I don't think I'll put too much.
all right, let's keep an eye on it. When it's at 100, you're gonna be no, it's not gonna be at 100 anytime soon.
Okay, what did you listen to the Prof G podcast about FTX?
I don't think so. What was it? What was the? How did I miss that? I listened to every single one of his.
So, what do you remember about FTX? You said it's one of the crypto company, the crypto
Right,
scam
Sam
company.
Bankman-Fried.
Yep, yep, yep.
I mean, he was. It was. It sounded like not a Ponzi scheme. I don't know if that's the right way to say it, but he was somehow he was selling something he didn't have. Or I don't know. It was the worth of it
Yeah,
wasn't what he was saying it was.
initially it was like a broker where you go there and you like Coinbase, like you make an account and then you buy various cryptos. I think that's how that was the business. And then they get a lot of traction, and then he had a lot of these endorsements. I think at some point he started lying about what money was liquid because he started making a lot of investments from it too, and that's where the downhill started, and then I think he was investing in these sister companies that he wasn't supposed to. Like he broke a lot of ethical things ultimately, and then when people realized they wanted their money back, there was no money to be had, so he went bankrupt.
Didn't he go to the White House and like
Yeah,
he
I
met
think he
with
did a
all these
bunch of like
celebrities?
interviews, but
Crazy.
ultimately, like when things go bankrupt, if there's something left, like somebody gets their money back, right? Like somebody gets their money back.
Right.
If let's say Walmart were to go bankrupt tomorrow, they have all these warehouses that somebody would get. Who has the right on whatever's seen in the bankruptcy? So I guess they have these claims, bankruptcy claims, and I think the Prof G guy bought some of these claims. I think they were selling very cheap because it's like nobody want to touch FTX. And when they looked inside, there was like they own like 9-10% of Anthropic, which is like the sister company to OpenAI,
Yeah.
which I
Wait,
had
FTX owned that?
owned 9% of Anthropic that Amazon has been investing in. And like I think they had a couple other investments because the Sam Bankman-Fried had invested in these startups before the downhill.
Okay. And
So a lot of these
what is
people who
that?
bought these cheap claims, like they sold the stake for $1 billion. I think they're going to, or I don't know. But ultimately, it was a very lucrative investment to hello for whoever bought
Talk to
it.
To keep joining guys. You know,
All right, perfect timing.
the smart people, you know?
We just finished our non-healthcare segment talking about investment in crypto and all that. Okay, so this is Dr.
No,
Lin.
nothing about that.
It doesn't
Gotta check
good.
out that episode, the podcast.
Yes, but this is Dr. Lin, family medicine, runs a clinic here in Dallas Fort Worth area, and I wanted him to come on board because of we're going to be talking about insurance and United Healthcare. So let's jump into that. So we had the United Healthcare CEO who was shot down and later found to be sounds to be like a vigilante type situation where this apparently very rich and successful like 25-year-old guy had some back surgery, had some issues, and ultimately wanted to, I think, hated insurance companies and shot down strategically CEO of United Healthcare Insurance arm, and that's kind of opened a lot of dialogue in this country. Surprisingly, a lot of the social media and the media has been very sympathetic for the shooter and not the person who died, which is weird. The important thing to understand is, which I knew people hated insurance companies, but this lack of empathy for the guy who died makes me realize how much anger people have towards like healthcare and specifically like the insurance companies, which is so scary to me. Because this is like, this is America. This is with the first world countries. Yes, we love our guns, but to have somebody kill a corporation CEO for perceived illness is kind of is actually very scary. I don't know when's the last time something like this had happened. People assassinate other people for political things, but kind of a moral justice very first time. At least I don't. When people joke about it, right? I mean, there's a lot of people who joke about, oh, Walmart is evil or this corporation is evil. Their CEO should die and things like that. I don't think it's right. It's there's definitely that anger, and let's try to maybe understand like what is healthcare. I don't think a lot of people understand how American healthcare works, how the insurance companies work. I don't think a lot of doctors understand how they work. They just understand the frustrations. I was hoping between the three of us, we have I work in the hospital side, we have family medicine, clinic side, and then we have a surgery side.
And the
Okay,
government side,
and the
if you
government side.
will.
Yeah, he works in American uh, one part of American healthcare that is actually government funded. Just so interesting. We can. I have some points, and we can go. So let me just go. Why do people hate healthcare? What are the what points can you think of? Why do people hate insurance companies? I should say.
I mean,
Harris, go ahead.
I'll probably go first.
Yes,
I mean,
please.
from an outpatient perspective, I'm my own clinic. I'm a young doctor, Dr. Garg and Evan Liggett. I think one of the frustrations is like we were really never taught about this insurance business until we got done with residency, and then for some of us who like Evan, who trained for a long time and hard work, it's like you just got over this mountain of knowledge and then the skill set, and then now you gotta learn this whole new thing. You're like, oh my God, what is this? So I feel like that's part of the frustration. And two, patients sometimes take that anger on you as a doctor, even though you don't understand about it. You know it's not your direct fault, but you have to take care of the patient. So I feel like that carries a lot of specific anger toward doctors. Like, hey, I'm trying to take care of the patient. I don't know a lot about this insurance. I don't know being a doctor, but I know the patient is, not getting the fair treatment because of the insurance is kind of messing around. Like for me, for example, a certain medication is not covered, or covered, but every year when they recess in January, you have to do like a new prescription, and then you hope that this medication will be covered, like albuterol inhaler, for example, the Pro Air brand versus non-generic brand. It's like, it's just like every year you have to jump through hoops for the insurance companies. I feel like that brings a lot of frustrations on the doctors. Plus, we're trying to learn how to become the best of ourselves, even after residency, to continue learning and honing our skills to critical thinking and managing patients and surgical skills, of course. So the compounds to it, and then plus the admin tasks. As the private practice, I have to delegate a lot of tasks to my MAs to do these authorizations. They do that because they work for me. So yeah, okay, I'm doing actual work, but I work for Dr. Lin. That's fine. But I feel like a lot of doctors who work for corporate, they don't have that luxury because because the MAs are like, hey, I just need to do the vital signs and then in basket and then that's it. I don't need to do extra work for you to do the prior authorization, which I think is a big hurdle for a lot of doctors like heme oncology, special drugs. I feel like that's probably more of a hurdle than the daily, routines. I feel like that, yeah, just compounds to it.
Yeah. So basically, patients don't understand. They're not expecting this insurance company. Maybe now they've been trained. So patient feel there's a friction. Doctors tells them, hey, you can't have this. I order this medication for you, but looks like when you went to get it, it was very expensive. So we have to try something else. Maybe what we tried doesn't work, and now we have to play hoops. Plus, from doctor's side, there's always various admin tasks, you know, uh, prior authorization. So if you prescribe something before that, you have to make sure insurance companies look like basically they want to notice before you prescribe. So that's the task.
I mean, the
Rule
thing is
change
like
year to year.
in the outpatient, you will prescribe it. Like I talk to you as a patient. The visit is finished. I'm not gonna tell you, hey, it might be prescribed. I try to bring hope and then confidence to my patients. Like I'll treat you with this medication, and you will improve on certain conditions. But we have to play the jump through the hoop on the back end, and that's what a lot of patients don't understand. Like, okay, how come this doctor try everything and then everything got rejected? So it seems like on the surface I'm not doing anything for you, but underneath it, I
Yeah.
have already jumped through like three different hoops for you got rejected by the insurance, which I'm, sometimes frustrated with, particularly United. And then seriously, like United, like probably, I think I told Evan about that. Uh, I had 6 patients on United Market Street plan, which is the Obamacare, after I started my practice, within 12 months. I was seeing them, everything was going great, took care of them, got them better. Suddenly, I got dropped out by the United Healthcare Insurance because they're saying, "Oh, this is Obamacare, and you're not supposed to be in this special plans. You're just supposed to be in the regular United Health Insurance. So we're gonna drop you."
They dropped
So
you as
so
a doctor.
yeah, yeah, yeah. So they dropped me, and then these the patients, they really want to see me. They're like, "Hey, you're my doctor. And I found you. I'm so glad." So the relationship is there, but because of the insurance issue, I don't know how to say it. I was just like, "Hey, I can't really see you anymore." It was just that felt very personal. It was like everything was going great, but because of insurance misshape, they really, just messed up. And then now I can no longer see them.
So you are
5
on
patients.
some United healthcare plans, but they don't want you on the other United health
Yeah, it's interesting. It's Obamacare, the Market Street. I'm sorry, not Market.
marketplace.
So what I understand is that, including other insurance, United, Blue Cross Blue Shield, Aetna, they only have a certain window for you to apply every year. You have to apply every year because the
As a
insurance will
doctor,
change. Like,
as a
yeah,
doctor.
and then if you miss the window, you cannot apply for that year. So you wait for next year, and you have to apply every year. It's like not the regular, the mainstream Blue Cross Blue Shield, Aetna, Cigna,
Because those are
United,
through
but just the
employers. Those are through
yeah, but
employers.
just
But I mean,
like
you're still
the
doing it just through employers. You're still applying every year because you have to do your employee benefits every year, like like in the late fall.
yeah. So
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 it's
that was particularly United specific.
So sorry, I don't have to deal with any of this, so I'm kind of interested here. So you as a doctor have to apply to be a provider in these insurance companies?
Yeah. So let's say you want to start your own surgical practice, brand new private practice. You have to apply. You basically hire somebody who apply for the 4 or 5 main insurance: Blue Cross Blue Shield, Aetna, Cigna, United, and maybe a TRICARE. But you have to apply yourself every year. Every
But
year, every two.
applying for United doesn't necessarily apply for all of the possible plans that they're on.
So what I understand is the regular plans you are on there, but if it's a marketplace plan, you have to apply specifically, and they have to offer it to you. Like for example, me and Prabhat, we live in Texas at Baylor Scott and White. Baylor Scott and White is very specific. Like on certain insurance, they have to invite me to apply for the insurance. I cannot just apply to Baylor Scott and White insurance.
And
So so it,
why do they deny or why do they accept certain positions? Like what is it? Is it based off of based off of what? As you as a practitioner.
no idea. These are very. Let me. Yeah. No. It's just they just have a very. I guess Baylor Scott and White, of course, they want to keep their territories and whatnot, so they don't probably voluntarily want like a single independent private practice doctor out there, taking part of their business, which I understand. Yeah.
so I have a theory, a thing I'm trying to understand. So I think the marketplace plans tend to be for people who are on the lower socioeconomic
Is
population.
is,
Who are
is it overall?
It's cheaper, but it's also I think they tend to be sicker population too. A lot more obesity and
Mhm.
diabetes because they can't afford a healthy diet and but the employers like Microsoft, like the big company, Walmart, these employers are able to like they want to give their employees a lot of options. So basically there are two types of insurance plans. One is gives you a lot of choice, like PPO and some of the other ones.
Yep. Yep.
And one is heavily managed, where they need to make sure like they trust you as a doctor. They know what you're going to prescribe. They're going to prescribe to this other cardiologist, being cardiologist, and they follow all the United or insurance rules. So they want to control a lot of the aspects of these heavily managed plans. So I think the marketplace has a lot of these plans where they want to micromanage a lot more, and they will say no to a lot of people, a lot of doctors because of that. And the commercial plans where you just get it through your employer doesn't have that many restrictions. I think that's what's going on. Do you agree, Harris? Does that sound all right?
Somewhat, but I mean, I'll say this: the people who have like corporate jobs, their insurance are usually not. You cannot select it. It's just whatever they select, which is
That's true
probably
too.
most
You
likely
don't have the
United.
choice of picking one.
The
It's
people who
selected.
are independent, like, I have a lot of people like truck drivers. They own their own company. They have Obamacare, like marketplace care, because they
So
can
the
select it every
self-employed
year,
people. Yeah.
and then every year they can try to find a cheaper one, and the affordable one that they can afford, and that runs into the problem because every year, let's say I want to go to United to Aetna or Cigna every year, and then I have to be like, hey, I gotta make sure you're on my plan so I can continue to be your doctor, PCP, for the next 3 years. Like, so it's a lot of that.
So it really breaks the continuity. Like other like Evan, who works for the government, all his patients are part of the government or have been part of the military. So like they're not gonna not be part of the government or
Yeah,
have
like
that government insurance next year. So he really
I
has
really,
none of that overhead.
I really envy that because
I think about this never because I see, yeah, it's like a single payer system. I
hmm
never ever have to worry about coverage. I order a
yeah.
prescription, I order a test, I'll get it done, and I don't
So
have
Evan,
to.
what happens if you order something and it's too expensive and the government doesn't like the government never says
No,
no
that
to a drug if you prescribe it or
never
you
had it
offer a
happen. I
service
mean,
to
there
somebody?
there are there are pre like when GLP-1s were becoming a thing. I had a patient who was diabetic and obese, and I thought, well, why don't you go to a GLP-1? And there was a whole list of medications that he had to try first. That's there, but and that probably exists for y'all too.
hmm
That I mean, eventually, if he would have reached that medication, they wouldn't have said no if he was as long as you met those check marks. Never anything denied.
That's fair. Try things. You talk to the patient. Patient understand too. Most patients.
It's so
But it's the
funny
one that's like
because
just
earlier in this
yeah.
episode we were talking about how Evan really hates all the admin work he has to do. So he's really hoping AI will decrease a lot of the admin work. And
Okay.
he doesn't even have the insurance hoops to go through.
Right. Sounds like I have much less than y'all.
Yeah, it's actually interesting because in private practice for like surgical, procedure doctors, you often find you go to a hospital and then you fix somebody urgently, but then when they get discharged and I try to refer to you, if you're not in network, I cannot refer to you. So you cannot
Hmm.
see the patient who you lay your hands on. That's just, I was like, who's gonna touch this patient, Yeah.
So yeah,
Well, sorry. The brings up a couple of points. So Marty, this whole CEO thing, every single podcast I listen to has talked about this, including Freakonomics. I listen to one called Plain English, Prof G, of course. But on Freakonomics, he had Marty Macri on, um, and he was talking about how a lot of big companies are turning to doing self-insured, and he mentioned specifically HEB. It's like they basically must contract with the doc. They basically eliminate insurance company as the middleman, and they contract doctors and I mean, they have a pharmacy, HEB,
hmm
and all eye, dental, everything. They just kind of take care of it themselves.
it's
I,
maybe
I,
HEB
I, I
can
guess
do
kind of
it.
like Apple, the
Right.
primary care. Yeah, that works. Yeah, because keep people engaged.
So I mean, so I mean, we can talk about like I'll try to go into how the negotiations kind of things work, but I think to wrap up why people hate insurance companies, I think the premiums only go up. I don't think ever insurance company has been like, hey, good news, we're gonna decrease the premiums this year. Like it seems to be going up and up and up, and seems like deductibles keep going up for people on deductible plans.
Yep. It's kind of always auto insurance, home insurance. They all go
Yeah,
up. I mean, I've never
insurance
seen
goes
auto
up,
insurance go down. Yeah.
go up, and then denial and seemingly barrier to getting the healthcare goes up. So I think that's a lot of the
Mm.
anger there. So how the insurance companies, like how the healthcare industry works, I think of it like three silos or three groups. In one group, you have people providing healthcare. We're at the end. There's doctors, nurses, hospitals, home health agencies. I wouldn't put pharma companies because they're creating a healthcare product that is useful, that has value. Medical devices company, they create a healthcare product. Delivery companies like McKesson, who take the drugs from manufacturers, bring them to hospitals and cancer centers. So that is the one big group of, I would say, you know, care delivery services or providers. And on the middle, you have the insurance. I don't want to call them, yeah, insurance companies. They basically run networks. So you can think of, there's so many providers, right? There's all the various doctor offices across the country, different hospital systems, different pharma companies. There's so many players on that provide a medical service or a medical product. And so I'll come back to the middle, insurance. Let's go to the other side. People who are buying the product or the service from healthcare. So there are three entities in this group. There's patients, because patients want to buy stuff. There are employers. Employers sometimes have to do this on behalf of the patients, and there are governments. Sometimes, in a lot of countries outside of America, government is the one doing all this negotiation, setting the prices. In America, we have a government plan that the Evan is part of as part of the military. But then there are also state Medicaid programs. States feel like they have to be there to take care of their patients. We have Medicare. The U.S. government, insures people 65 and older because they feel they have, like an employer, they feel like they're obligated to provide. And it is in the law that they have to provide. They have to make sure their population is healthy, right? It's not like Medicare is the insurance branch of the government, but government has a responsibility to, make sure people are as healthy and have access to good health care. Make sense so far? So on the buyer side, patients, employers, and government. And in the middle, because you have these three people, and think of how many patients there are. 350 million people, various employers, 50 states, because federal government Medicare is centralized, but each state can run its own Medicaid program, right? So there's inherently in the system, there's a problem of all these people that are trying to buy healthcare. They need to connect with all the people that are going to be selling healthcare services or products. So we already have this problem, and the solution has to be something needs to sit in the middle and connect
But
people.
why does something, if I go buy an apple, there's nothing sitting in the middle of me buying an apple?
Well, there are certain things, like just for payment processing, there are Visa networks that are connecting Apple's bank to you and your bank. So there are.
Okay, but that's the same thing with the buying healthcare. If
Correct.
I have to
That's just
use
the
the
payment
payment,
aspect.
right. So there doesn't necessarily have to be a middleman. We created a middleman
Correct.
in our system.
You can talk about, like, in other services, you can say, theoretically, you can say everything could be free market and you don't need a middleman, period. You can say insurance has a role, maybe for extreme emergencies. Like, you can buy a house, right? You don't even need to buy house insurance. Car insurance is mandatory because you can, at least liability, because you can run over somebody or hit somebody's property, and government wants you to be covered so you can actually pay for the property you damaged. But you don't have to get insurance for your own car if somebody hurts your car. But you can go buy a car. You can buy a car from anywhere, like different dealers, different manufacturers.
I think the insurance for health insurance is very personal. It's not like car insurance or home insurance. If you skip a payment here or there or don't get it, I mean, whatever. But your health, most people, they want to live longer. They don't want to have cancer. They want someone to fix their hip or appendicitis or gallbladder. They want the help there. They don't want to, hey, I'm sorry you didn't pay for your insurance. We're not going to fix your gallbladder.
But why have
To them,
insurance? Is there a world where we just
big,
have a
I feel
payment plan? Like, you just buy a TV, you buy a washing machine, you need the
because
appendix removed.
because the bill for these are extraordinarily high. I mean, the ER visits,
But do
I
they
mean,
need to be high? If they weren't ridiculously high and if they were appropriate cost, if replacing a hip wasn't like $50,000, if it was
the hospital.
$4,000. You
If the
know,
hospital can significantly lower the price to a reasonable
yeah.
amount, and then there's a potential argument for deleting health insurance.
I mean, a lot of Americans can own $1,000 phone. That's just one phone,
Yeah.
like iPhone, right? Plus they got some electronics, and they're. I think to Evan's point, there's a lot to be said of just having a free market where people can expect a certain quality. So there could be a third party uh, agency that at least that may not be the connector, but that can be the assessor of quality, right? So if I need to have my hip replaced, these we're talking about elective things. We're not even talking about emergencies. Or let's just say hospital. If I get a stroke, what are my options? I emergently need to be. I need to buy some healthcare service emergently. What do I do? Do I call 911? Where do
I
they
mean,
take me?
when those happens, this is this emergency. You're not gonna think about insurance. You're gonna think
No,
about
Right.
your
but you will.
lives.
You will call 911, right? You will call 911. Now
Yeah,
911
but the
has that
last
problem.
thing across your mind is the last thing you do want to think about actively is the price you pay. The first thing is like, hey, am I gonna live? What
Correct,
am I gonna
correct.
tell my family?
But either way, like right now, you call 911, you have a stroke. The
I don't even know what I
operator,
have, but
no,
I
but
just I want to live.
yeah, but the operator does that for you. Like they call the ambulance company, the ambulance service, and the ambulance service already has a document that says for stroke in this area, we go to the closest stroke center hospital, which is kind
Hmm.
of graded through government quality metrics, and they take you to the closest stroke center. They're not necessarily going to be like, well, which one do you want to go to? What is in your insurance? What is in network for you? They don't really ask you this kind of thing. They just take you to the ER, and then the ER stabilizes you and then decides what to do next. So
I
so
mean,
so we have a role. I think we definitely have a role for rating agencies, which United States has. There's government star ratings. We have some private group. Leapfrog is one of them that try to assess quality of different, at least the hospitals and doctors. But I think there's
I
still
do want
growth.
to
Continue.
say one thing about the price, the significant high price. I mean, the book we read, the price we pay, right? So give an example, in I think New Mexico, right? So the C-suits on the hospital side and C-suits on the insurance side, they negotiate every year. It's like a game,
Yes.
okay? Like I'm the hospital, you're the insurance. I ask you to pay $5 for a hip replacement. You're gonna be like, all right, we'll pay $4. But then you're gonna be like, when you'll go home, you're like, you know what? This costs like $10,000. Next year, hey, I wanna get paid 9,000. Can I do that? Okay, not 8,000. Then the game goes, and then there's a point where like, okay, I'm gonna ask you to pay the reimburse for the insurance. I want insurance pay for the hip replacement in my hospital, 10,000. But I'm gonna ask you 15,000. But my business game is like, okay, I want you at least pay me 10,000.
Yeah,
So
it's like negotiating, right? You're over
yeah, see,
asking. You're
yeah,
hoping you settle on a number that's
yeah.
profitable for you. So, I mean, you need
It's
some profit.
unfortunately,
You need some profit for things to be sustainable, so you don't go
mhm.
bankrupt and the hospital can continue to operate.
So that's from the book, but then also from my personal experience too. I talked to all these primary care doctors here. Yeah, the way we bill, we do ask for I think $200 to $400 per visit, but the insurance when they reimburse you is like 200 or like 50% less. But if you ask, "Hey, I just want you pay me $10 for this visit," they're gonna just pay you $10.
Or five.
Yeah, or five. So this business of like, okay, the provider or the business people for the provider, hey, I want to get the max return for these doctors' work for me too, because I'm part of the health group. What is my negotiation strategy for the insurance company to pay me as much as I can? And then I feel like that over time, every year, over the last 30, 40 years, has gone out of control. We're like $15,000 for an ER visit. Like for us, we see someone's bill, we would not be surprised. Okay, yeah, that's a ER visit bill typically in America. But then you see you also not be surprised when you see the coverage, the insurance says, oh, you know what, I only pay $5,000, and then patient will tell you, oh yeah, I only have to pay like $200 for that. But then you're like, wait a minute. In the beginning, this number was 1,500, 15,000. How did you get down to $200? This common story, I'm sure for you and both Evan and Gar and Prabhat, it's a very common theme, and you will not be even surprised by now. Like, okay, this is kind of how it goes in America. But that's my general
But
gist
the
about.
like what angers me in this scenario, because I do think free market could solve, like, America's superpower is free market
Hmm.
capitalism. It can have bad consequences,
Hmm.
but a lot of the time it does wonders for us.
Hmm.
And the one
Okay.
example I love, that I think one of the most perfect businesses in the world, that is a gift from capitalism and good governance and does so much good for Americans, is Costco. It's such a wonderfully run business that everybody loves. People who work there love it, customers love it, investors love it, like the C suite people love it. And I think if we could replicate what Costco does well into healthcare or any other industry, honestly, I think a lot of healthcare problems will go down, because the biggest thing Costco does is it uses its size to bring you like good value, good cheaper prices, good products, good service. And the bigger it gets, the more it can help its members. Healthcare does not take that route, because even Costco suppliers love Costco because it is not mean to them. It is so big it could actually squeeze the suppliers, but it does not, because it wants a sustainable ecosystem.
Yeah. So I think that the intention, right? Like for-profit hospitals, like HCA, for-profit insurance company, when they come together, it's like, you're pouring gasoline on fire.
But
It's like,
Costco is for profit, right? And I would
yeah,
I
but
would argue, like, grocery stores, Costco, Walmart, Kroger,
hmm
HEB, these are in a way healthcare companies, because I mean you can live without insurance and seeing a doctor. You cannot live without predictably having food tomorrow.
yeah, but also Costco is a specific kind of grocery store. I would also majority of grocery store like Walmart, Kroger, HEB, they still. I mean, I don't know if HEB is on the stock market, but they still want to generate profit.
They want to, but I think it's because of competition,
Yeah.
because that's what free market is supposed to be. It's supposed to be competition, bringing down prices, increasing quality. And if you can't keep up, you have to leave the game. You can't play anymore.
But then interestingly, in the healthcare world, right now we're doing the value-based care, like the Medicare Advantage. I'm not sure Evan knows a lot about this, but it's like it's a Medicare Advantage, but doctors, patients, they all hate it. It seems to bring value, but actually brings a lot of obstacles for patients and doctors to jump through to just to get the regular care that traditional Medicare patients want.
Hmm.
Right.
Yeah. So talk about I forget what we are talking.
Then you want to turn Costco method into like insurance
Yeah,
company
because
and
what
then
Costco does
hospitals.
is it uses scale to make sure, like, it just self governs, because there's so much competition. Walmart's around the corner, Amazon is there, all these other grocery stores, it tries to just have a 3% margin. Insurance companies are regulated. Like, they cannot make too much profit, because government will look at that as it'll be weird.
My
And
understanding
all
is their profit margin is not that great either. It's about 3%
Yeah, insurance
for the
companies, I
insurance
would say
companies.
like 4 to 6%, 5%. I mean, it's still not like, it's not
Like
like tech
if you're
company
talking about a
15%.
company, if you're talking about for-profit companies and measuring how they're doing, at least from what I've been gathering over the last couple weeks, they're not killing it, right? As far as like that, the 3%, 5%, whatever it
In
is,
terms of just profits, here, since we're talking about this, I'm gonna
Right.
pull up United Healthcare
But the United Healthcare seems like
financials.
the top 10 earners for stock companies.
Yeah,
Is that?
so here you can see. So these are like 2021, 2022, 2023 revenues, and this is billion. So $285 billion in total revenue they brought in 2021. Okay, and then in 2022. So you can see there's a little growth in revenue, how much money is coming in. Okay. And then the insurance premiums are a big part of their revenue. I mean, their expenses on top of this, which is also growing. And insurance premiums are like, marketplace people pay into it, your employer, and you through your paycheck you pay into it. Government is giving them money to support programs that Medicare manage. So that's one part of their revenue. And you can see the margins on the premium business, it's like 5%. I mean, it's like Evan said, it's not a big margin. Granted, it's a 5% of a huge number. So there are profits there. But if they go negative, like if they don't control their costs, like that could be a big loss to them either. Also, but it's. I mean, I think how they control their cost probably needs a lot of work because it makes so many people angry and it takes so much time away. And then they have a PBM. Do you guys understand what PBMs are?
More or less.
So it's basically, like the regular insurance, like the role of insurance is to negotiate prices with the doctors and hospitals. PBM is basically the same thing, but they negotiate prices with like pharmacies and pharma companies, with CVS and like Pfizer. So that's also to me they're just basically a type of insurance business within United and other companies. But their profit
It's
margins are also
Mark
like,
Cuban's favorite part of healthcare.
yeah, I think he's doing direct to consumer, trying to work around insurance companies. So that they also have a margin of about 5%. And how the report is kind of weird. But I try to understand how the United Healthcare works after the shooting, because I want to understand the anger and how the business actually works. United has two businesses. So one is the insurance business. Other is you remember so insurance, right? The middle column of our 3-column strategy. One was people buying, like patients and governments. One was doctors, and in the middle there is the insurance that's trying to make things affordable by creating like subscription. So they're basic subscription plans, right? Because you pay into it and they promise you access to product and services. So there's an insurance arm. And then they also have Optum, which is kind of going into the provider. So they're trying to vertically integrate into buying a lot of doctor offices and home health agencies, that kind of stuff. And they're growing that business quite a bit. And so they have two things. Let's say Optum Health is where they own the doctor's offices. And then Optum Insight is they take all this I think proprietary data from Optum Health, from insurance, claims data, and they have Optum Insight, which is their data business. So there's a software business, like a high margin business, where their margins are like 25, but I think it's actually 40% probably margin, given the type of business it is. Within Optum, that's growing at 30% within United Healthcare. So this business in itself, I think, is about 40% of value within United Healthcare, parent company. It's such a big business that they're focusing on. So yeah, so I think I wanted to highlight two things: that the insurance margins are very little. That doesn't mean they're like saints. I think that the one thing they do really bad is they don't try to control cost for everyone. I think there's really no incentive either. They really try to control cost when they're fully vertically integrated. I think that kind of like a Kaiser or the government, because right now the government model that Evan is part of is that people who are paying for it, who are giving you access, are also the same people that are the doctors, right? And it doesn't change year to year. So the government system has an incentive. They can think long term. They can have their own rules. The rules stay They don't change arbitrarily year to year. And I think that's what a lot of insurance companies are trying to replicate in America. Does that make sense? I don't know if I confused everybody.
Yeah, I mean, the business side, I see more transparent. It just, it's going back to the Costco example that Prabhat brought, compared to this United Health Insurance, the impact that United Health Insurance makes are very personal. Like, I cannot get the surgery that you guys offer. I cannot save myself from cancer. I'll die from the disease because of your delay or denial. So versus like Costco, hey, I can buy the hot dog at your Costco, but it's more expensive. Oh, well, I'm not gonna buy it. But even if I don't buy it, I'm not gonna it's not gonna be end the world for me. I can eat something else. But
But
the
Harris,
but
I
then
want you to think it's personal because you're taking for granted what free market competition has done in the grocery business, that you feel comfortable because you have so much choice. You know you're not going to starve tomorrow because if Costco doesn't work out, you can go to Walmart and get food. Like someone
hmm
grew some fruit in Brazil and brought it to Walmart super cheaply,
no,
and you
but
can,
even if I starve for a day or two, I'm okay. But
yeah, but
but
you're
the
still
United thing,
guaranteed, you still feel secure. There will be food in a week. Like you
yep.
will find food in 3 days because America, like the current globalization, whatever the food market, like America doesn't grow all the food. It comes from different country. But you can be
hmm
assured you're not worried about starvation. You're more worried about obesity because capitalism
Yep, yep.
works so darn well at
So
certain
then
things.
with this insurance thing, right? So going back to the full circle, like I mean, how would you fix it if you were in the position?
So I think we got to eliminate the idea that it's going to be a free market because I don't think that's going to happen in our
Why?
lifetimes.
Like you think it should not happen, or you think it will not?
I think it won't happen.
If you were the
In addition,
kingmaker, if you were the president of healthcare, would you want a free market? I mean,
well,
obviously, emergencies and stuff like there are
right,
some corners that you have to think about a better solution. And there's already free market in certain corners, like beauty surgeries, LASIK eye surgery. Some of the Ozempic stuff. People were paying out of pocket because they saw the return on their they liked the product and service. So yeah. So what do you think in terms of what should happen and
I
what can
mean,
happen?
I'll say those plastic surgery, those LASIK surgery, the cash pay prices, it is free market. It's free market. You're like in a contained space. If I come in, I was like, hey, let's say I'm a plastic surgeon. I say, hey, $5, I'll do liposuctions. The other people, they will like they will try to attack me. Like I will not survive in that business, in that environment. There's no way, right? Like if you offer ridiculous prices, that's why the people who offer ridiculous prices are either like non-plastic surgeons or poorly trained. Because the trained one, they're not gonna offer that out of range pricing. So that freedom of capitalism and try to get a right price for it,
You're saying that,
yeah,
but you're saying it's not really free market because it's free market because in terms of pricing, but you don't really know what to expect in terms of quality. That's what you're really saying, Harris,
yeah.
right?
I mean, they
You don't
probably
have a
they have organization. They're probably gonna be like, hey, we no one here is gonna offer
yeah,
like
but like if
hundred
what
bucks.
Costco, if Costco gives you like a really cheap priced TV,
hmm
it's not gonna be complete crap because Costco has a brand behind it.
That's not true because Costco, like, so for example, the hearing aids, every year they have to sign a contract with the their company. They will try to fight for the lowest paid hearing aid devices.
Okay.
So it's not always highest quality. So a lot of patients to me will complain, hey, I got a hearing aid from Costco. Yeah, it was very cheap, but I mean it was very affordable. Not cheap, affordable, but I did not really like the end result.
Okay.
Like the quality wise,
But
it's kind
still,
of
I
like
mean, there
tires.
like you
Yeah.
won't think like it's complete scam. Like you don't think it's like a crook surgeon who's gonna give you a very, very bad result. I guess my point being, when I say free market, I'm talking about, both things, what the price is and some sort of what kind of quality to expect. I mean, like today, people like, you know, millennials, I mean, they buy things on Amazon. They will look at reviews to get an idea of, I mean, there are testimonials from people who, I mean, they can be scammed a little bit. They can be hacked, but like testimonials from people who have bought the product and told you what to expect. You take a Uber ride, you like when your driver is a 5-star driver versus a 3-star driver, right? Like you feel more confident. And these are not
Yeah.
dormant, like these are kind of, I mean, I'm not saying patients should rate their doctors, but I'm saying there needs to be a well thought out. Like if a surgeon is doing hip replacement, it should be transparent to everyone, to the patient specifically, what the outcomes, how many has he done? What were the outcomes? How many worked fine? The patient was happy at 30 days, 5 years, 10 years? How many
I
turned
think
into
I,
bad infection?
I think you can find that, right, Evan, right? You can find surgeons' performance. There's some websites that shows that. Or is that like
Well,
personal thing?
for me, I track. You can have your own. Like I don't think you can look up my outcomes.
Okay, okay.
I track my data in my own registry, but I can easily manipulate that or not put the data. There's no, as far as I know, I mean, there's NISQIP and like National Surgical Quality Improvement
Mm-hmm.
Program. I think they track. I think hospitals are um, supposed to report to them, and so they
Mm-hmm.
track certain outcomes.
Okay,
But I don't know if that's not publicly available. That's more for research purposes.
I see. Not for the.
So
Right.
so a perfect market, I think there's some idea of what kind of quality I'm getting out of this doctor I want to see for my problem, assuming it's
Mm-hmm.
not an emergency, like whatever, and the price. I mean, so you can make your own decision. The problem with insurance companies' health, and I think why the price keeps going up,
Mm-hmm.
because both sides, right? Both sides kind of play off each other. The hospital side, the health doctor side wants
Yep.
more money than last
Yep.
year, and they probably think they need to increase the price because they feel insurance companies
Yeah, because
giving
we all
them
know.
less money, so they have to ask for more just to get what they need. So it creates this huge positive feedback loop on prices. The prices keep going up and up
Because
and
we
up
all
and
know
up.
like reimbursement every year is
Yeah,
getting, like in the doctors group, we don't hear like, hey, reimbursement is going up every year. No, we heard across the specialties like
yeah.
reimbursement are
And,
getting
and the
lowered,
biggest problem
right? Yeah.
is lack of price transparency, in my opinion, because
Mm-hmm.
when United or any insurance company makes a contract, I think the entity contractually, based on the contract, is not allowed to tell the patient what
Yeah,
the
and then
insurance company is actually going to pay them. So
and then
you
it gets
need the
confusing.
insurance, not for insurance company to pay for the service on your behalf. You kind of need to pay the premium just to get in the club to get access to the right price,
Mm-hmm. So
right?
all other things like other complications is this the in-network, out-network thing. You have a surgeon like Evan, he's in my network, I get to operate on. But you're the anesthesia, you're out of my network. So like I am covered with Evan, but I'm not covered with you. So and
Yeah,
ultimately the
that is
bill,
that is just ridiculous. That the
right?
patient can, even for elective emergencies,
Mm-hmm.
it's a little bit more understandable. But if you have we can't talk about hip replacement, but I
Yeah.
think most people are aware of what it
Elective
is.
gallbladder surgery,
Yeah, yeah.
elective, yeah,
You go
gallbladder.
to see somebody, you check their network, and now after 3 months later, you figure out maybe the CT scan that was done was read by a radiologist who was not in network, and the
Yeah.
anesthesiology services wasn't in network, and then there was a facility fee for the whole thing that the insurance company's not going to pay for. Now you have to pay for, and I mean all these things come from lack of transparency from the doctor, because the surgeon
Mm-hmm.
doesn't really, there's really no way to know. I mean, there is a way to know, but I think that's not common practice to make sure, because it's hard to keep track of which patients you uh, um, are covering. but you don't even know which anesthesiologist you will be working with, probably, because it depends on the
I mean,
schedule.
you probably do with for that, like private practice, but the radiology, that could be a problem because you can order the imaging on the same hospital you work at, but it can be read by a
A
radiologist that's
contracted third party person.
yeah, contracted, maybe even teleradiology. So it's not someone you know in the building.
So yes, theoretically, these have solutions where maybe doctors start working with exclusively with other doctors who follow the
Hmm.
same insurance coverage. And that's what starts to happen. Insurance are networks, right? So insurance network is like United. It goes to the hospital, like Baylor Hospital that I work at, and it says, I represent so many employers in your area, so many patients in your area, and the government of Texas, and have you have these, patients, Medicaid patients or whatever,
Hmm.
that I want a really good deal because I represent so many people, so many patients. And then a big hospital like Baylor, who has a very strong footprint in Texas, can come back.
Hmm.
Well, I represent so many doctors, so many ERs, urgent cares, ambulatory surgical center. We're gonna have to give me like a better deal than like someone like you, Harris. You have
Hmm.
your own solo clinic, no other providers.
Hmm. Yep.
So for people in solo clinics, they feel like they don't have any advocacy when it comes to negotiating insurance prices because there's you can't compete with someone like Baylor. So your only thing is what you can do is join a hospital network. Like in Texas, we have Baylor Network, a Presbyterian THR network. So you join these networks that now you kind of group your negotiation rights, and now you go back to the table like, hey, I'm part of this THR network. You better give me this rate
Hmm.
because that's the deal I signed
Yeah.
on. You probably have to pay the hospital network now some money, or you have to give them referrals, like there's some
Yep.
in
Yep.
return. So that's what keeps happening. There's all this negotiation going on, but the networks keep growing on, and like there's a soft lock, right? Even though a patient can go to any cardiologist, now you as a provider are a little bit incentivized to not just pick the best cardiologist if that's what you want. You kind of incentivized to send the best in that network that you're aware of, right?
If you're lucky, because you might not be see eye to eye with that specialist.
Correct.
But
And there
because
may
of the
be only
situation
one.
you're in, you have to refer to that guy, and then you know that maybe he's not very good to your standard, or you don't communicate with him well, and then overall it affects the
And even
patient
that's
care.
subjective because you may have an opinion based on one or two things that happen. Like there is
Hmm.
no aggregated database for this cardiologist. Oh, he sees like
Hmm.
80 patients and or I don't know, like he's seen 40,000 patients in the last 20 years, and he was able to help them lower their cholesterol or whatever, like the stents that were put in, they were good quality. None of them got STEMIs or stenosis risk was really low. They didn't have hematomas from the surgery, like these kind of things. There wasn't like overbilling. Like you don't have that data, so even though you are making a judgment call, it's based on very limited information compared to what is possible. I think we could have a much more educated decision making on provider side and patient side.
Yeah.
So I think so. One thing would be increasing transparency on outcomes, increasing transparency on pricing. I think if we just do those things, and if the government made the rule like this, you cannot have hidden pricing, and you have to have robust long-term outcome data for all the healthcare services. And I
So I
think,
think Trump did that in his first term.
okay,
He had a presidential order to increase to have price transparency on. They ended up agreeing to some smaller number of procedures or whatever it was, and I think now it's under legal review or something. But basically, he was trying to. Somebody in his circle came to him and said we need to have price transparency. And he had a presidential order about it.
I mean, it's a bipartisan issue. I mean, no, like both parties agree these are the solutions, and
But
but
the
the
problem
problem,
is there's lobbying. That's the issue. To me, I think the entire. You asked me if the free market will work. Sure, I'm sure it'll work. Absolutely, it'll work. But
it just
it
doesn't
will
exist.
not happen because of the lobbying.
So you're saying, which I agree with, United States, the country that embraces free market, does not have free market dynamics in healthcare. There are a lot of monopolies. There's a lot of monopolies that that are fighting a lot of attempts for free market. And because free market means people will potentially make less money in every corner of healthcare, and we'll have to have more accountability in every corner of healthcare. I'm talking from doctors to hospitals to pharma companies, logistic companies, retail pharmacy. Everybody would be more liable, and nobody likes that. And I think it just creates that's the hump we have to get over. If we can get over
Oh,
that,
sorry. It's the politicians. There's never they're lobbied by the insurance companies and every other bad actor
I mean, there's probably
to
healthcare,
not
like
not
hospital lobbying
change.
too. There's probably lobbying from both
Yeah,
insurance companies and like ACA, or I don't know who represents the
But
healthcare.
I feel like without regardless of insurance company or hospitals, they are lobbying for how do I get more out of this. There's never like I'm gonna lobby to save people's lives
right,
and get people care. I mean, there's probably, but
right.
it's not as powerful as the people who wants money. So I feel like
It,
yeah, to make financial like for profit insurance and for profit hospital, that's inherently like a flawed design.
So you think you do
well,
you think
by
non
the
for
way, not-for-profit Forbes analysis of 82 largest non-for-profit hospitals in the U.S. found the vast majority paid their top executives between 1 and 5 million per year, and that 15 paid between 5 and 26 million dollars per year for their top executives. The not-for-profit hospitals are making profits, you know, hand over fist. This isn't. I don't think it's about that. I think it's about
and yeah,
if we're talking about transforming the price transparency, we're talking about reforming the insurance market. I just don't see it happening.
I think there is a I think it can happen. You just have to. I think sunlight is like the best disinfectant. So you have to just because right now I think a lot of the hospitals are by law have to put prices, cash prices, on their website. I
But yeah,
think
so that's a thing, but then they hide it. It's very hard to find.
yeah, it's
Very,
not a
very
good
hard to find.
link, and it doesn't have to work perfectly. There are small fines if they don't do it. So incentives are still weak. It's happening.
Hmm.
Incentives are still weak. It's kind of like how TurboTax, like there's a free version, but you can never find the free version. The only one that keeps showing on Google is like the paid version. And then whenever Google wants to say, or when the government wants to say, let's make our own platform, TurboTax is like, no, 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 we have a free version, and then it just goes disappears.
Well,
But I think if we could mandate, like this is what the government can do. Like government, a lot of doctors probably realize the government healthcare has problems. And we're talking with Evan, who actually works in the government healthcare. So I don't know if you see bureaucracy on your side. I think this is one instance where government can step in and make free market better, improve the the market dynamics by
let
self-insurance.
me let me read you the Scott Galloway quote and see
Okay,
see how you feel about it.
please.
The whores, better known as our elected representatives, keep letting the pharmaceutical and healthcare industrial complex maintain this mendacious fuckery duopoly of sugary, shitty foods that get you obese, then turns you over to the diabetes industrial complex, which has created regulatory capture and charges a bunch of money to people to die slowly. So, what do you think of that?
Ahmed is saying like government is kind of liable at the end of the day. At the end of the day in America, the government is responsible for you.
But they're
Either
not
you,
doing anything.
yeah, well, they're not allowed to do anything, right? They're not allowed to like the
No,
biggest
they're allowed to
intervention.
vote on our behalf. They're being lobbied to not
Yeah,
do the
yeah,
right thing by these
that's true.
industries. Like this
But
is
I mean,
not a
like,
secret.
but things like sugar tax, right? Like if you could put sugar tax, especially on things sold to kids, like that would create so much better incentive to have kids that don't grow up on sugar and fructose corn syrup. But like that the rhetoric of government shouldn't be part of this. I mean, of course, like if at the end of the day, when someone is 65 or older, the government is responsible for their health. Or someone goes broke, gets on Medicaid, government is responsible for that. or they got on dialysis because of diabetes, the government is responsible for them. So why not government responsible when they're like, and developing, prime to develop bad habits? Like, so, I mean,
I
if you
think
have,
you're right about the price transparency. I think that has to, and the quality, the outcomes need to be known too. Price transparency known, but to me, one, and I don't know the numbers behind this, but it seems like I don't think we're going to change to a free market system. I just don't see it happening in our lifetimes. But you could still make changes to maybe get towards there. But to me, in order to save healthcare dollars, something has to fundamentally change about our healthcare isn't healthcare. It's death care, or it's like end of life care. We have the insurance market should be for just like every other insurance market for a disaster, not for getting your medicines and for treating your diabetes or hypertension
agreed.
and routine care. Like we have to fix the Americans' health in order to fix, in part at least, to fix the healthcare system. There are too many obese, diabetic people. That leads to a lot of other problems like knee problems and back problems
Mm-hmm.
and lost productivity. I think we're not, I think
So,
our healthcare system has to change its thought. The healthcare is not about, yeah, having a heart attack and getting treatment for that. Okay. But what about the freaking 30 years that led up to that? That
Yeah.
shouldn't be a part of the healthcare industry. That shouldn't be a part of the insurance industry. It has to be something else that changes that.
I feel like that has to do with maybe the culture of America. Just ultra processed food. We grew up in cafeteria in high school, tater tots, pizza, hamburgers. I do this talk every day with my people who want weight loss patients. I tell them it's not really inherently your fault. It's the culture that you grew up with. Even someone who grew up in different culture like Chinese culture or Indian culture, that you grew up in carb heavy diet, like dosa and rice. It's just inherently really hard to tell you to change that. And I tell my patients, that problem that Evan's talking about, part of it is, I blame the culture they grew up. It's not. I mean, you didn't really step out your mom's womb and like, I want to eat candy. It came to you. The advertisement on TV, it tastes great, give you reward. You get good grades in school. School give you a bag of candies. It
yeah.
still happens
Do you
today.
think it? Do you
Yeah.
think it's the healthcare system as it is today's job to fix that, or do you think that like
That's I feel like
whose responsibility is it to?
that's beyond the healthcare. I feel like the umbrella is way up. 'Cause, me and Prabhat were talking about. I have a guy, a friend from France, and we look at a graph of the obesity across the world. One of the lowest country is France, 10%. Alabama, I think Texas in America
About
is like
obesity rates,
30%,
right?
40%. So then I asked him, hey, how come like across the border from France to Spain, Italy, and Germany, it went up to 20%, or London? He's like, oh, because our food, we make it better. I'm like, interesting. Because I was like, I know you guys in France eat a lot of food, like baguettes, macaron, 5-course French meals. You guys are so into food, but I mean, I doubt. I mean, I have some doubt on that, the truthfulness of it. But I'm like, it's interesting because you guys don't work out either. There's no like gold gym in France. I mean, there's probably a few, but not a lot. So he was telling me a couple of things. One, ultra processed food, they don't eat a lot of that. They try to cook fresh. The ingredients are fresh, okay. And two, they said they do a lot of walking. And third one is because they're very into fashion. They have this quote unquote fat shaming in society. They don't, if you are overweight, they don't look great with that fashion. So a lot of that, still comes down to
Hmm.
culture. It's like, okay, that's a very refreshing point. Okay, all right. So
So,
even in my GLP-1 people, like the people who lose the most weight, find one thing is the medication with the diet. I have people who don't exercise or minimally, they still lose 6 pounds, 5 pounds per month. Yeah.
That's what Atia said recently. Is like he was talking about
Yeah.
that in a recent podcast. It's like if you're trying to if you're trying to use exercise to lose weight, you're doing it wrong. It's gotta be your
Yeah.
diet.
Because I have an example, interesting one. It's a guy who does marathon. Iron Man. He's one of my only guy who cannot lose weight. He's already on max Z-bound. And then at first few visits I don't really believe him. I was like, okay, like this guy does marathon 25 miles and Ironman cannot lose weight. If I do that, I'll be like, ripped. But then I saw his photographs of his event and all that and all the logs. Okay, and then after like a couple visits, okay. But it's interesting. His wife does similar, but a lot less intensity. Lose easily 5-10 pounds per month. He gained 1 pound.
So is his diet terrible then? Is that what you're
So that's
saying?
the thing that's what I'm saying. I think the key, I feel like from my personal experience, no, is I feel like diet is still key. Even though he still diet during the regular days, but I think one of his problem is he does these, extensive workout, but after that immediately he hoards food. Just one or twice, maybe that night or the next
But
morning.
the
That
Z-bound
enough.
should decrease the desire to consume a lot of food, right? Even if it's
Yeah, I
bad food?
mean, yes, yes. I mean the GLP-1, yeah, it will cut down sugar craving. It will make you eat. If you eat more food, it will make you nauseous. So give you
Yeah,
negative
yeah.
feedback.
So even
Yeah, yeah,
that is not necessarily working for him. Uh,
yep.
and your point being, if you continue, if you think this medication is going to do 100% of the work, that is the very terrible mindset. Because it's like having gastric bypass surgery. If you
Mm-hmm,
get the surgery and you continue to eat poorly, your
mm-hmm.
body will just adapt because you're giving
So
your body mixed signals of what you want to do.
yeah, I mean, coming to the evidence thing, American healthcare that is responsible for American food. I feel like this diet thing is I feel like key to success because the burgers, the pizzas, the wings, the sandwiches, they all have carbs.
So
The candies, the kids eat, the donuts, the cake, and then even like the Starbucks, the drinks. It's not, a guy from Europe will never order what is it, double macchiato. They will laugh at that. They'll be like, I'm from Italy, or and then I see it on TikTok, like I'm from Italy, and we never see this order in Italy for this special drink you
yeah, I
order.
mean, like lattes were fine, but now
Yeah,
it's basically sodas for
yeah.
adults.
'Cause like the double sugar, the double shot, that's an American thing, like double Whopper, triple Whopper, like a Whataburger. That's yeah, that's like
I never ordered
only,
those things at Starbucks.
only America would do that.
Like
Oh yeah, let's do
frappuccinos, just like
yeah,
just
let's
very
do
high.
two of that, okay? So I feel like they're changing that, man. I don't think
Okay,
American healthcare is responsible for that because it's encompassed all the food companies, the
okay.
coffee companies.
I'll try to summarize. 'Cause I think we kind of
Sorry,
came up with a
I made
fix.
it. I led us down a wrong path.
Yeah,
No,
it's
no,
okay.
it's a
Yeah.
very good because that's also the three-legged stool, right? The three-legged stool of American healthcare are the patients, the culture, the insurance company, or the whoever. Like I call insurance company like the Access because they have turned into, like you said, it's not really about insurance anymore. It's about just getting access to preventative care goes through insurance, which is not what insurance was supposed to be. And then the doctors,
Mm-hmm.
I think all of them have areas to improve. Patients need to improve their culture. Insurance companies have to improve their price transparencies, and the doctors need to improve their outcome data. I think if we do that, then I think we will see a lot of reform organically. And I know we talked about negative things, but I think every industry has a lot of positives. Even oil and gas cause a lot of pollution. I think because of like without oil and gas, I don't think we'll have food tomorrow because there's so much fertilizer to support 8 billion people that is dependent on like the oil and gas industry. Similarly, pharma, yes, they create expensive drugs, that they have their patents that they try to extend, and they have the opioid epidemic, but they also gave us GLP-1s that do work. They gave us a really quick, COVID vaccine, all the other drugs and stents. You can put a stent in somebody in the corner. You don't have to do a cabbage or basically a heart.
I mean,
So there's
that
all these things that come out of
yeah.
this private industry that are good. Even insurance allows when you have a bad accident, like the hospital doesn't just say, well, you don't have insurance, like you can't pay, so go die. A poor person through pooled risk models of insurance can afford otherwise expensive medical care because of insurance. Other countries, I've seen other countries, people who don't have insurance or money, like when something bad happens, they just know. They didn't even try to go because they know they will get rejected and they just slowly die at their house.
Mm-hmm. That's,
So those are all the big things. But I'm going to go over my notes and of the fix and you guys add in. My first one is don't treat insurance as access or membership, where it's not insurance company's job to make sure you're eating well or you're not getting diabetes. It should be your responsibility. Or if you can't do it, you need rules too because, sugar, that's the culture you grew up in. The culture needs to change. You're like either your head of your family decides, head of your community decides, head of your city decides, your state, or your country. So ultimately, it needs to be an authoritative decision if it's an impulse issue. And same thing with heroin, right? Government made heroin illegal because it's bad. Smoking has taxation, so we have reduced access to it. So I think at minimum we need to have a sugar tax, if not like completely ban refined sugars in things that children consume. We don't even let 13-year-olds or younger on the internet allegedly because we
yeah.
think there's harm, right?
I mean, it's a smoking thing too. Like you can't smoke no longer in a room. I mean, and also it's a culture thing, right? Like it's no longer considered cool. Man, people still buy, with a vape. So I mean, it has
There's
changed.
friction built
Like
into the
that.
system to
Yep,
disincentive, to create
yep.
so people don't do it.
But even alcohol, right? Prabhat told me like there's a movement of not alcohol parties. So I feel like that those momentums of people changing, having a group can do something positive.
I agree, and
I'm
I
trying to
think
I'm trying to smoke more in the OR to try to buck this trend.
Hey, you can probably do the vaping and then do the oxygen mask, and if I do that, yeah. I mean, you're the boss, no worry. I don't think anyone will say anything. They're like the guy has a knife. Don't talk to him like that, okay?
so. I think we have a lot of these health managed plans now, where the insurance companies, like these all risk models, where it's up to the insurance company to keep the patient population healthy or manage their chronic things, including Medicare Advantage, where it's up to the insurance company to make sure if you're a heart failure patient that you're like going to the hospital less. Like it's a very hard job. Like the only way to win that business model is to be picky and only pick people who are going to have initiative and they're going to be good patients or who don't have a
But
lot of
but
health problems. Like you
also,
want to,
you're trying to like polish this device, like make it improve, right?
it already
I
has scratches
think
on it.
I think me and Evans were like, okay, no, like we gotta pull the rug underneath the thing. Like this whole device does not work at all.
Yeah.
To say, hey, how do I make the insurance company more keep the in business and profitable? That inherently will affect some people, and then these people they're gonna be very unfortunate with terminal illness or rare conditions that needs a lot of advanced care, and then it's a bad
Well, I'm
result.
just saying, like someone like for like keep insurance for those very big expenses. Like you got
Hmm.
cancer now, you want to get
Sure,
better. Okay, you
sure.
let's use insurance there. You got hit by a car. You have broken bones. You have to go to the
Yep,
ER and get surgery.
yep,
It's gonna got a lot of resources. Let's use insurance there. And not everybody's gonna get cancer. Not everybody's gonna get hit by a car. Not everybody's gonna get a heart attack. Well, if we continue, I think the problem is the incidence of these expensive things has gone up, where a lot of people are on dialysis because of these preventative diabetes and obesity issues. So now we
hmm
are going from the society is naturally going towards prevention, and we are using what the only payer options we have, which were insurance companies. We are saying, hey, I know you're supposed to be for emergencies, but how about you just do everything? And instead of insurance companies, we will just have you as a gatekeeper for everything, where if somebody doesn't have your membership, they cannot even see a PCP, a regular doctor. Like now, you are the gatekeeper. So they went from insurance companies to access to healthcare companies. I think which was done with good intentions. I don't think anybody was evil to be like, let's do this. I think we just got over. I think we need to bring back that accountability back because I think a lot of companies countries in Europe and including Japan have some sort of co-insurance model. I mean, some of these countries that have full unlimited access to ER services, that kind of thing, you see similar things. People like overuse it.
Mhm.
All the old people hang out in the ER because that's where all their friends are. I guess one of the videos I was
Yeah.
watching, the joke in Japan is like people discussing in the doctor's office. I haven't seen like Mr. So and so in a while in the office. He must be really sick.
Mm.
Because
Yeah,
only the healthy people go to the doctor office.
yeah,
All the sick people just stay at home.
yeah. In Japan, it's actually interesting because I mean, I heard another podcast. They're saying that their model is that you're a doctor in the local community, and then everyone see you, so it's very regional. But it's very hard to get into the doctor for acute care because everything's appointment based because they have their very or like ways of doing things. There's no way to fit you in
Well,
like a
Evan
acute
worked in
visit.
Japan too, so he could give us
Yeah,
more.
I feel like that's interesting. I was like, okay, you cannot. I mean, I guess the only place I can go is ER.
Which is fine because the ERs exist. You don't have to be shy about going to ER because normally it's just easier to go see your doctor or call the office or whatever. If in an emergency, you just go to the ER. I think like Germans especially have similar thing where I think everybody has to have insurance. 90% of people have the government insurance, but the 10% of people have private insurance, and you can flip flop. By default, you have like government insurance, and if you're like a rich person who wants quicker access to everything, you can jump to private. But then that's it. Now, till you die, you are on that private insurance model. And it's
Yeah.
regulated. Private insurance can increase prices beyond like 5% every year. People tend to have more ownership for their health compared to general American population. So I think these countries,
Yeah, I mean, compared to it's interesting compared to other countries.
yeah,
When we encounter this problem in our country, we're like, okay, what about other people in the world? What do they do? So, I mean, there's a lot of pros and cons, of course. Like we hear on the country, third world country. I mean, not third world, but other countries like Canada or UK, yeah, Europe, where like people complain, hey, I've been waiting for like 6 months to see a dermatologist. I wait like 9 months to see a surgeon. I wonder like, do those problems like logistically, do they go to ER if it gets worse or just could they go away? But they also say, hey, I had a a heart attack. I went to the hospital in France. I actually got paid for the visit because I didn't know how to pay anything. And then at the end of the visit, there's a lady who paid me $5 for so that I can get a meal when I discharged from the hospital. So that was like interesting.
I think for America, I would love, because so many people, like we discussed, right? So many people have the government insurance already, like
Hmm.
the military people, everybody on dialysis, people 65 and older. I would love for government to extend the Medicare on the marketplace. Like, I'm not saying just give it away for free to everybody. Just make it a plan that I can pick. So I can,
Hmm.
like, as a competition, like the services you're providing, you can negotiate. So I can just be like, well, I just have the Medicare option because that's the one I pay premium to. And and the government would have a completely different incentive because at the end of the day, government most likely is going to be there for you when you're 65 and older in this country. But the United or some of these private insurance companies, they're only going to do so much, right? They're like, well, what if next year you switch insurance or something changes? Like, why bother doing a lot? So I think
Hmm.
that would be great having government compete, and I do think like essential like having a preventative care for people who I think first of all I think people should just pay for their health care for the low acuity stuff. Like you want to go see a doctor, you should be able to just pay. It should be cheap enough where you can pay. That is, a visit is not $200. It should be like $40, and you just go and you pay, and that's easy. And then you can have some community free clinics for people who truly cannot afford, and that can vary. But
I
I
mean,
think,
that's already there. I mean, let's go on residency plan, okay?
I think if we had all this transparency we talked about, we could actually bring naturally the cost to see
But
somebody.
you know, So the other thing is, us doctors, we also have to talk to each other to kind of form like united, like get on the same page.
In
Because
terms
there's
of
some
what?
doctors out there like trafficking and all that.
Oh, I see. I
Because
see.
cause,
No,
yeah,
but that's
because
what I'm saying.
once
If
we
you make everything transparent, where you can see the outcomes of the data of the doctor, and you can see the price for the service, I mean, the bad doctors are going to get filtered out automatically. At least
I
that's what
mean
I think. I
they'll
mean, it's possible if we
yeah.
implement it, we see some other problem that I haven't thought of.
Hmm.
But I think if you just transparency in itself will fix a lot of perceived problems naturally.
Yeah, yeah. I mean, just get people accountable in community and talk to each other, and then make each other accountable. That I don't know how that's gonna roll out, but it can be very effective.
And
Because there's doctors that offer like crazy management that's really out of line guidelines. Patients see that as like, oh, this doctor's doing a lot more than other doctors for me, so I love you, and you're gonna be like this Dr. House in the community. But in fact, when we work in the system, we're like, okay, that's not how the guideline works. It just yeah, that's not how this works. Because I had a guy patient come in with this is Evans territory, but like pelvic mass. It's like a lymph node, but it could be cancer. But it's all this plastic surgeon who just want to remove it. I was like, even I know from surgery rotation in residency, I mean, in medical school, that you're supposed to do a CT, evaluate if it's spreading or not. You're supposed to just like cut it. It was kind of big and hard. I was like, I told the patient that. Patient was like, no, the surgeon was very nice to me, and then I'm doing what he says. Even though I tried really wholeheartedly offer my best medical opinion, they think because I'm doing less. I want him to get second opinion from another doctor that I trust. He thinks, no, I don't think it's necessary. Very respectfully, too. He says, I'm going to just go through the surgery. It's interesting because the smart doctors that I see are the people who do less, not do
Hmm.
more. And then when you do more in the community, patients perceive you are the better doctor.
because that's the only thing
It's a
they can
very,
do. Like, there's no other way
yeah.
to judge. So you go to
Mm-hmm.
like your natural instincts. Action
Mm-hmm.
is good, inaction is bad,
Yep.
especially when you're
Yep.
pain. Like imagine like, hey, you have very common, right? Urgent care, people get cold, they pay the fee,
Mm-hmm.
they go see the doctor, and doctor is like, you don't need antibiotics, go home. Like, but I paid you money, give me something.
Yep.
The service I'm here for is not consultation. The service I'm
Mm-hmm.
here is make me better now.
Yep. 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 It's also dual too, because the patient will feel that way, and then you sometimes instinctively will be like, hey, like they pay a lot of money for this visit.
Yeah.
I should do more. Like even though it's not by guideline, like if you see 40 a day over like span of three,
Yeah.
four
It's
years,
just easier to have that
you'll get to
conversation.
that point.
You're like,
Yeah.
let me just give you some steroids and antibiotics so I don't have to explain
Yep.
to you, go back and forth.
Yep. Yep.
But that's why I
I don't
think
know.
just having patient reviews is not a good idea. That's why I think it needs to be objective data. Like, hey, I had 2,000 patients come with cold symptoms. I saw
Mm-hmm.
them and I give antibiotics to like 5% of them,
Mm-hmm.
and
Mm-hmm.
then all of them actually went home. And people who were hospitalized later or died later were like less than 1%. Like, if you had that, you'll see, okay, I like this doctor. I think I'll feel comfortable going to this doctor. If I had all that data.
And that's why these like functional medicine, what do you call those? Like concierge medicine, that's kind of on the like IV fluid or supplement side. They are not only growing, but they're prospering. Because like Garg was saying, they do more. And the patients will feel like, okay, they offer me vitamin IV infusion.
Your
I
B12
swear it
shot and like
works. They do these like 12 panels on my APOL1 protein to check my increased risk of heart attacks. Like seriously, like that. I tell my like, residents in training, and they're like, oh, why? Well, if we go by the guidelines, how come these patients go to these other doctors? I'm like, there's a reason. These patients are not inherently like not smart. When the doctor is not giving the voice that they want to hear, they will find somebody. Especially in America, like God was saying, the free market world, they will find somebody.
which is fine
to
because
tell. Yeah.
maybe the doctor who's ordering the APO1 lab
Mm-hmm.
is doing the
Mm-hmm.
right thing because that wasn't taught in
Yeah.
residency, and
Yeah.
they
Yeah.
did their
Yeah.
own research because
Yeah.
we have discussed about some of the advanced lipidology stuff on this podcast,
Yeah.
like Evan and I, and there are some
Yeah.
really good evidence for some of this stuff. Now, I mean, there are people who are getting the
I mean,
same
it's
things.
still new, right? It's still out there. We don't. I mean, as a
Yeah,
doctor, the best we can say is I don't know, but it sounds really not intelligent
and
from the
there's
patient.
a lot of like frivolous stuff, like testosterone shots. I mean, there's so many fringes of healthcare where if we made a completely free market, where
Mm-hmm.
like the people will get addicted on opioids again, because because that's the natural evolution. I mean, people, what do people want? To feel good, euphoria, and who can have it? Like doctors can give it to you. Like there's zero oversight.
Yep.
So
Yep.
I think we
Yeah.
need some oversight. It's a tricky industry, but I think we have a lot to learn from free market. I think if we go back to some of those basics, increase transparency, increase competition, I think quality will automatically go up. Costs will automatically start to come down. Maybe remove
Mm-hmm.
some red tape, let some of the people who are trying to innovate on things, but they get like spooked, like, oh, healthcare is such a big industry. Like, I don't know. Like, if I want to create an app to detect skin cancer with the camera, it's so hard to do that unless like you're Google, right? Just
Mm-hmm.
because how do you go and like, you legally can't just put it on the market. You don't have the data. Like I wish there would be more pure data sets open to public and somehow integrated. I wish the healthcare industry would have like a startup program where they automatically integrate some of the startups and they could figure out a way to keep things private, but to just have innovation. So I think the fact that we still use faxes is kind of because I mean I think we have a tendency to shun technology. So I think
Yeah. I
yes.
mean, I'm probably against the idea of a free market. I'm probably more like along with Medicare for all, the VA system, even though that also has cons too.
No, but that's not. We're not saying opposite things. I mean, you can
Yeah.
that's free market because now government is able to enter the game. There's
Mm-hmm.
another. It's not just private insurance companies competing each other. There's you can have government plan. You can do supplement. Everybody get baseline government plan, unified EMR access. So
No, but
that
I'm just saying. I'm saying the. I mean, I'm disagreeing with you, but I understand your point. But just the I think the philosophy of where we come from. I feel like after seeing so many years of doing the healthcare on my own, I feel uh, I feel like that might be my personal take on this.
no,
Yeah.
I think it's good to disagree, but I think we're saying the same thing. You want government to be part of the choice. You want government to be there. You
Mm-hmm.
want people who don't can't afford. You want them to have some sort of a government plan where government will give you access to the PCP. I'm
Yep.
saying that you can do
You know,
you can do that
yeah, it's
baseline
because.
and then have people compete for supplemental insurance if they need it, or you can just
Mm-hmm.
have people like I was saying, maybe government plan just shows up on the marketplace and you can just take
Yep.
that.
Because the middleman, that's a problem. And then two is it's too much of a service industry now.
Where
Because
you have to,
we're
yeah,
doctors. We're like supposed to be the judge of a case. You cannot be influenced by I want to make you I want to make my score look good. I don't want to make you mad
yeah,
to judge my medical opinion on this matter because this is a serious thing.
yeah,
I feel like that inherently it's a I see every day. It's in my brain. Okay, do I tell him the everybody go through this? Do I tell him the real thing, or do I tell him something that he want to hear so that I can avoid conflict?
correct. Which is easy when there's an
Yeah,
established relationship with the primary. Like if you've seen
yeah,
their family for like
yep,
10 years, 20 years, you can be
yep,
frank. But if it's the first time
yes,
you're seeing that person and they showed up in the urgent care, it's like,
yeah. And also, as medicine has gone so long now in the Western medicine, we have come to a point where like a lot of medical problems like PCOS, diabetes, Clot syndrome, they become very ill defined and very like cross multiple specialties.
yeah,
So the strategy we try to manage these patients sometimes it's very challenging to kind of
Because you're saying different doctors have different strategies. Is that what you're saying?
like for example POTS, right? You can see the neurologist, the cardiologist, and anyone they're not familiar with that, they can dismiss the patient, and then it cause more problems. But I'm saying, go back to the point, the doctors and patient they both want an easy solution for this. They don't want to explain to you a complicated graph of how this works and this is why you have this. They just want you, hey, can I get the testosterone shot for my symptoms I feel? Here's the shot. I feel like that image is still instilled in our mind as doctors. Okay, how do I fix this patient in front of me the easiest way? And then the patient be like, okay, how do I get the easiest treatment from you? I don't want to diet or exercise to lose weight. Can I get the, you know,
Sure.
yeah, the
The
shot.
injection.
Yeah. Which is why it's so successful last 3 4 years. Yeah. But these are all good topics. It's very interesting. We're all young now. I mean, 20, 30 years later, I don't know what will
Well,
happen.
in the spirit of free market, I have two
Yeah.
resources that I have personally used to buy healthcare for my parents. And
Mm-hmm.
like I've gone on these websites, got some like MRIs or ultrasounds or
Okay.
colonoscopy. I found the cash price. It included everything, and I paid with cash. Insurance wasn't even involved, so it didn't really help me meet my deductible,
Yeah.
but I
So
managed.
so so those patients who want to cash price, you cannot tell the imaging center on the first visit that you have insurance. If you do that, they legally cannot tell you the cash price because you're already engaging with the insurance. That's just the tip for the
But there's
for the
this
patients.
business called Assist Health Group. And
Mm,
I don't know, I think they work with employer because there's so many, like, there's employers buy insurance for their employees, but
mm,
because they get confused on which insurance companies to negotiate with how, there are also
mm.
middlemen there that try to help employers pick
The
the
middleman for
insurance
the
plan and
middleman.
benefits, like,
Okay,
which
okay.
is
The middleman
like
for the middleman.
middleman for the middleman because everything is so confusing.
So you're saying that your dad, your mom both are employed by, I assume, companies, corporate, right?
Correct. And he has health plan. He has like a high
Yes,
deductible plan.
you can still find a way to select a certain insurance package for him.
Well, I knew what he needed. Like, I mean, he needed a colonoscopy,
Yeah,
right? So
yeah.
I
No,
was
no, but I'm
like,
saying like, I guess the problem is like, okay, a lot of our audience here, they just work for a company. They have a fixed insurance plan. So are you saying that there's a way to kind of have them select a different one?
no, I'm saying there's a way to look for healthcare service providers who just will give you a cash price. Like, you
I see,
don't,
I see, I see.
even if you have insurance, you don't have to use it.
Okay,
Because
I see.
I mean, I just find the hassle of it, like finding and like a lot. So here, I mean, you can like pick colonoscopy. You can give me a zip code.
92011.
Carlsbad, California. Okay, how much is a colonoscopy cash price from y'all stand?
1,000.
Mine's free.
No, the government people are so useless.
Like
They don't know.
what do I think it is?
Well, here
The other one's probably 4,000
you can
because the
go to
anesthesia
Los
fee.
Angeles Gastroenterology on Harvard Boulevard, so it has to be really good. But $1,200 that includes
Anesthesia.
anesthesia, that includes
Okay.
biopsy
Okay.
results, that includes everything. No
Okay.
facility fee. So if you have a HSA plan, like this is really good. Like like that's like a little bit more than an iPhone.
See, like the other problem, I mean, this is very good. I'm glad Garg showing that. But the other problem with these procedures, like if there's a complication and you take the colectomy, how does that
Sure, but
work?
you have an insurance, right? Like I'm saying, you can have an insurance if there's an emergency. You have
Hmm.
insurance, but I'm saying
Okay.
for
Okay.
these kind of things, you don't need to have.
Standard things that
Yeah,
should be
So
no
wait,
complications.
who would use this if you just had catastrophic insurance and you wanted to
yeah. If you have a high
like
deductible insurance with a big like deductible and you use HSA plans, you can use this.
okay.
Or if you don't have insurance, you can still use it, right? I mean, if you really needed something.
Or if you have United Health Insurance.
Like here, let's do imaging.
What
Give me
about
an imaging.
ERCP?
You're gonna go to ERCP.
I'm just kidding. Maybe they don't. Maybe they don't have that on there.
No, they probably have it. They have it. They have
They
it. They have it.
have probably not, because that's more of a surgical thing, right? No, they just have.
No, it's not like I think GI or surgery, gen surgery, they both.
Okay. How about a CT of?
Okay, let's do
That's
that.
like that's average. Like I think 250 in my area.
CT abdomen pelvis with the contrast.
With
With
contrast.
yeah, with or without both.
Okay,
That's fine.
what was that number zip code again?
92011.
So 300 cash. That sounds pretty cheap. I mean, I usually hear CT scans for 2,000, 3,000.
No. It's not. It's not. It's like your MRI is like $500.
But this is cash price, or this is what?
Yeah, cash price.
How do you know cash price then?
Because I have imaging company come to me advertise.
Okay, so you are right.
Yeah.
250. 250. But this is not if a patient wants to get, at least in the hospital, because I see hospital side, so I see prices I see are like 10 times or more, right? So
On
there,
the hospital side.
yeah, on the hospital side.
Because that has to
Is
do with
it-
the urgency of things. Yeah.
True, but I mean, sure, but
Because this
I
CT can be
think,
taken, then the radiology reads it 3 days later.
but I think if patients knew that they can get a CT scan for $300, 250, I don't think they will necessarily feel like they have to use insurance, or they have to rely on insurance,
Yeah.
because I think that's pretty affordable. I think most people, if you ask them how much it costs, they'll probably think it's at least $1,000 or more. What do you think, Evan?
I agree. I think I've heard that around that number before, but I would have. I probably would have guessed a little higher.
Yeah,
What about just like a regular office visit? Is that in there? Or these are just procedures.
well, these are, yeah. I think they have this radiology one, and for some colonoscopy, or like GI type procedures, upper endoscopy. I don't think they have. I don't know how they like. I think they must network with different centers like throughout the country. 'Cause I think they might be in every state, but I don't know if they. I don't think there's an office visit, because that I think more complex. I think.
But you got the DPC, direct primary care, for
Yeah.
that. I mean, for primary care, of course. It's like $150 or $100 per month membership fee. Though usually those you sign up for at least 12 months just for the subscription package.
I mean, when I
But
lived
you
in,
get you get unlimited, visit with the primary care doctor.
India, we just pay the doctor the cash price. This is before credit cards, in cash, for whatever. But it was like a lot of acute visits, right? It was always like 3 or 4 low acuity, like urgent care type things, like someone who fell, you have a cold. There wasn't like a lot of like let's prevent your diabetes type stuff. But you always just went to see one doctor, some report. That's how it worked at that time. So there are tools like this. That's the point. I mean, there's good RX for drug prices. Oftentimes, if I need like antibiotic or something, like I have the insurance price, but then the cash price is like even cheaper.
Yeah.
Or is it cost plus drugs? They're kind of the same thing?
Yeah, cost plus is a little bit different. I think it's probably similar, because cost plus is such a different. It can be a really good concept. It can be a really bad concept, because it just means you're taking the cost of the service and you're adding a small profit margin, and then you're selling the product. And Costco does cost plus. They add like 3 to 11% margin on the things they sell, so they're not making a lot of money.
Is this from like
This is a Mark Cuban guy.
Oh, okay.
But cost plus can also mean really bad. Technically,
Don't
insurance.
call him Mark Cuban guy. He might get angry. Okay?
This guy.
Just say Pride of Dallas. Okay.
I mean, he's not part of he doesn't own the sports company anymore, NBA team anymore, the Mavericks.
Yeah, but you still live in Dallas.
He does live in Dallas. Yeah. So I mean, this is a good. I'm glad this exists. So he's trying to have like 15% margin and sell everything with full transparency for with the hopes that this decreases.
Yeah, I think this is very good for like primary care. But the inherent problem is the specialty drugs, like urological drugs, GI drugs, cancer drugs, right?
Yeah,
Still
I mean those are, but it
falls in
solves
that,
some
yeah.
problem, right? But yes, the specialty drugs are problematic, and
You know, patients they become so effective now that sometimes in a doctor's mind it just would make complete sense to skip to that one. You know,
I
I find it
do
interesting
think
that the dermatologies actually they do a lot of PAs for authorization. You think it's easy, but they do tons of that.
I do
Yeah.
think inhalers are where, like, some of the cancer drugs, I'm like sympathetic to pharma companies because they take forever.
Mhm.
Like, there's a lot of R and
Sure.
D involved. But
Yep.
inhalers, I think, is so stupid that they're not cheap because they can be. They're not very expensive to manufacture. And I
Yeah.
think there is a like Alina Khan or like FTC did something good in the sense that I think they were going to force a lot of the inhaler companies to cap at $35. So I
Mm.
don't know what happened to that. Do you guys have you guys heard about that?
There's a new one called Air Supra. It's a albuterol with steroid budesonide. Seems on research is more effective than albuterol alone. But then they do give patients coupons, so it's like still affordable for people with regular insurance, not Medicare's.
No, but I think effective, like, again, like I think it was supposed to happen in 2024.
Mm.
I'm using this perplexity here in AI to figure out some of these things. But like, I think this was supposed to happen where multiple pharma companies were going to cap their inhaler prices $35 for like a month supply. So it's supposed to happen, and it should have a big change. And like, like, should be less people going to the ER because they can't afford their
Hmm.
inhaler. But I guess it's delayed. That's one thing with American healthcare. Sometimes there's a policy, but they're like a 3 year for people to get enrolled. You know. So, well, any parting thoughts? I think we covered a lot of good
No, I
stuff.
mean, it's good. You know, this is my first one with you guys, so good to thank you for having me on board. You know, talk about healthcare, but you know, good to see everyone's. I mean, I want to hear more about Evan's next time, his experience
Yeah. Okay, Evan,
with
you
taking
you
care of
can tell
patients.
us from the government standpoint. I don't know if like any surprises. Do you feel like government has the same
Magic
problems?
systems, perfect.
Okay, that's what we need to.
It sounds like a lot. I mean, yeah, it sounds a lot better than having to haggle with insurance companies and getting medications. I could tell you that.
I
It's nice
also,
to be able to.
I mean, I have to do some haggling for like I have to do some peer to peer, which are really stupid because they're almost basically when somebody gets to the hospital, the insurance company says they shouldn't be admitted. We're not gonna pay for the admission, or sometimes they're like,
Hmm.
well, they
Yep,
need
yep, yep,
rehab. We're gonna pay for the inpatient rehab, which is more
yep, yep.
expensive. And even then, there's a peer to peer involved, and they often the 99% of the time, or maybe that's too much. A lot of times they'll deny it. There's nothing you can do about it. And but for these denials, they have like 3 days to 3 business days to decide. So patient just sits there and we're like, well, what's happening? Am I going home to a nursing facility for rehab or rehab?
That just increased cost
Yeah,
overall. 3 days in the hospital.
and
Yeah.
it's so that's probably the part where I have to call the insurance company, talk to somebody, set up a peer to peer, have them call me, and then sometimes they're like, oh, we don't have all the information. What you're telling me sounds like, yeah, they should be approved. So it's just like, and I think there are companies, we didn't go into this breakdown that they're, because I mean, a lot of peer to peers and prior authorizations sometimes are often done by like third party insurance companies. Don't want to do them in house, they'll give it to somebody else. So, and they get paid per denial. So it's just like, instead
See,
of
that's another thing. The motivation, this incentive for profit, stock market, denial, claims, way to create hassles, obstacles for providers to go through this, inpatient, outpatient, surgery or non-surgical. It just, yeah, we're not even talking about patient care. This thing, yeah, we're dealing with.
It's a business, and it's weird
Well,
because most industries have just like a buyer side and a seller side. We have so many other middlemen where it's like a mesh. Instead of just being two people trying to increase the supply and demand for goods, there's like it's a system where people shouldn't be dying ethically. They should be able to get care, but who's going to pay for it? They're like there's so many players involved. There's like a gridlock, and nobody wants to. It's like a Mexican standoff. Like nobody wants to take the first step back. So it's just weird.
well, my parting thoughts are, there's a lot of distrust in the medical system, and I think there's a lot of distrust of doctors, and I think part of that coming out of COVID was from recommendations that the government was making. But what I see, and it's, talking with y'all is reinforcing that overall we're trying to do the right thing. It's just a complicated system. We will, hopefully progress with discussions like this amongst the community to get to do better.
Yeah. But I mean, it's interesting, the discussion bring more questions. Okay, how does other countries exactly their system work? What are the pros and cons
Sure.
in other countries? And then we can find that, and
No,
then maybe next time
it's a
discuss
whole,
about.
they have healthcare economics, right, at all the
Mm-hmm,
universities. It's a
mm-hmm.
whole, we can't possibly solve, like no podcast can solve this issue in 1 or 2 hours. You have like
Yeah, yeah.
I will say
it's like an ongoing debate.
But
America
I
is
mean,
the
Vince highlighted.
only, but America is the only country with not just one model. We have like 5 models for healthcare. Every other country finds one and sticks to it. Germany has one model. Japan has one model. America has a government, military has one model. The hospital have one model. States have their own insurance. It's like some employees have their own insurance. They're doing self-insurance. It's just like it's like a party where everybody is like trying to figure it out. Walmart, huge employer, they try to do self-insurance, and I think they're like exiting that line. Amazon, J.P. Morgan, Berkshire Hathaway try to solve healthcare. Like huge companies, and then they're like nobody wants to budge. They're like, and they put Atul Gawande in charge. He's like has multiple books, like Being Mortal, or like a couple others,
Mm.
right? Checklist Manifesto. But they had
So I
to
think,
like it was just very difficult problem. Nobody wants. There's too much gridlock.
so I think, it's very fragmented, and then each state has their own thing, and then, Walmart or Amazon, whoever. I'm sure there's one area in America, like a regional, that has like above average, like this part of town of America, their health overall. Doctors are more satisfactory. And then I just want to take their brains, like, okay, why is this particular situation
Yeah,
work so well? That's interesting because like the guy was saying, we're all split up, and then there's like different formalities, and we're all different regions. It's very hard to unite and have one voice. But my thing, okay, let's say we have 47 different voices. There has to be one voice
yeah,
that's
it's
somewhat, hey, above the average,
it's
right?
working out.
Like, okay, like I want to check out that voice. Like, why does that work? I
Yeah,
think
I
that
think
might be the
I think
answer.
sometimes there's like confounding factors, like the zip code. The rich people will have better.
Mm-hmm.
Everybody's
Mm-hmm.
gonna be happy, patient, doctor. The poor people are gonna be more sick. They have
Sure.
relatively worse eating
Sure.
habits. So I think that, but yeah, if you can find like a system that has multiple different type of patients, and they all tend to
Mm-hmm.
have better healthcare, then yeah, then it's easy. You study that, and then. But I think what we discussed is probably what's going to happen. I think a lot of systems that have good outcomes and they're doing better than everybody else is because there's some sort of price transparency. I don't think that many people have better outcome data. Sometimes if it's vertically integrated, like Kaiser is the insurance company, is the provider company. So they have a lot of internal data. They hire the doctor, they have internal transparency in all sorts of things, and they can try to do a better job than other people.
But yeah, like Kaiser might be above average, I would say,
Correct. Even though
in
it's
terms
big,
of
I'm
I
sure it has
started
a
working for Kaiser.
Or you said you won't work for Kaiser?
No, I said I started working for
Oh, you
Kaiser
started working for Kaiser.
as per diem. I'm not one of their like
Okay.
How's your
contracts.
experience?
It's good. I mean,
I think you should go to
I like
a
it so far.
regular world, and then tell us, because I feel like you're so, because of the government plan, you're like most.
I mean, I'm remembering to a certain extent residency when y'all talk about things. I remember having to really grind to get approval, and patients sat around waiting for things. And,
I see.
yeah.
So I
Okay.
think, yeah, it's a good discussion, guys. I think we probably just solved it. Next time we can target peace in the Middle East.
All right.
Yeah, we got
Very
other
good.
problems like this, Middle East, North and South Korea problems.
Oh, we didn't even discuss about geopolitics.
The economy of Japan, how do we get that better? And then, UK, European Union, Russia.
Brexit.
No. Brexit.
Texas exit. Texas should gonna exit
Yeah.
the United States. I'm just kidding.
Okay. All right.
All right.
All right,
I'll
guys.
see you guys next time,
Talk
okay?
to y'all next time.